Call this meeting of the Amador County Board of Supervisors to order on this Tuesday, March 22nd, 2022. The board is met in closed session. Item 1, conference with labor negotiators. There was no action. Item 2, conference with county council, existing litigation. Direction was given to staff. Item 3, confidential minutes were approved. And with that, if you could join me in the Pledge of Allegiance. I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all. Thank you, and good morning. Welcome to our meeting today. We will go to public matters not on the agenda. Discussion items only, no action to be taken. Any person may address the board at this time upon any subject within the jurisdiction of the Amador County Board of Supervisors. However, any matter that requires action may be referred to staff and our committee for report and recommendation for possible action at a subsequent board meeting. There is a 3-minute time limit. Is there any public comment for anyone from the audience today? Hearing none. Anyone on Zoom, Jennifer? And any board comments? Okay, thank you. And we will move on to approval of the agenda. We do have a regular session agenda item, Board of Supervisors discussion, possible action relative to the chairman's signature on a letter of support for HR 690 as it relates to immediate suppression of wildfires. And this will go be placed on the agenda as item 4N. So with that, can I have approval of the agenda?
So move to approve, Mr. Chair, with the correction.
Moved by Supervisor Cruz, second by Supervisor Brown, to approve the agenda with the addendum.
I'll second, yeah.
Okay, Supervisor Axe. I was going to give you the second since you tried to make the motion too, but that's all right. With that, any discussion? All those in favor?
Aye. Aye.
All opposed? Motion carries. Approval of items on the consent agenda.
So moved. Second.
Moved and second. That was Supervisor Ornetto, right?
Yes.
All right. Supervisor Ornetto, second by Supervisor Brown, to approve the consent agenda. Any further discussion? All those in favor?
Aye. Aye.
Aye. All opposed? Motion carries. Item 4A on our regular agenda, Child Abuse Prevention Month, discussion and possible action relative to adoption and presentation of a resolution proclaiming the month of April as Amador County Child Abuse Prevention Month. And we do have a resolution. Go ahead and read that. In the matter of resolution proclaiming the month of April as Amador County Child Abuse Prevention Month, whereas all children deserve to grow up in a safe and nurturing environment to ensure they reach their full potential, and whereas child abuse and neglect is a serious problem affecting every segment of our community, and finding solutions requires input and action from everyone, and whereas child abuse can leave long-term psychological, emotional, and physical effects that have lasting consequences for victims of abuse, and whereas our children are our most valuable resources and will shape the future of Amador County, and whereas protective factors are conditions that reduce or eliminate risk and promote the social, emotional, and developmental well-being of children, and whereas effective child abuse prevention activities succeed because of the partnerships created between child welfare professionals, education, health, and community and faith-based organizations, businesses, law enforcement agencies, and families. And whereas communities must make every effort to promote programs, activities, and policies that create strong and thriving children and families. And whereas we acknowledge that we must work together as a community to increase awareness about child abuse, contribute to promote the social and emotional well-being of children and families in a safe, stable, and nurturing environment. And whereas prevention remains the best defense for our children and families. And, I would ask the board to approve this resolution.
Move to approve.
Second.
Moved by Supervisor Brown, second by Supervisor X, to approve the resolution. Any further discussion? Any public comment? And all those in favor?
Aye.
Aye. All opposed? Motion carries. And I'm going to go to item 4B now, and I'll present this resolution to Tracy Carlton, who's going to give a presentation on this item and the Child Abuse Prevention Council. Tracy is the Child Abuse Prevention Coordinator for First 5 Amador to display a quilt in the County Administration Center in the month of April to commemorate Child Abuse Prevention Month, and a request to put up a pinwheel display in front of the County Administration Center for the month of April. Tracy, I'm going to give you this resolution right now.
Morning.
Morning.
Thank you for passing the resolution. We appreciate it very much for our children. Tracy Carlton, Child Abuse Prevention Council. And every year, April is Child Abuse Prevention Month. It's nationally recognized. It's an opportunity to bring awareness to all the efforts we do here in Amador County and across the nation to keep our children safe and give them the happy, healthy childhoods that they all deserve. So we have several activities that we do every year in recognition of this month. And as you see on the agenda, one of them is a pinwheel garden that we have at various locations throughout the county. And the pinwheel is the national symbol for a healthy, happy childhood. And so we have displays throughout the county. And last year we had one here at the administrative building, and we'd like to have one again this year. So we're asking that of you today. And then also we have on April 1st is Wear Blue Day. And that is another day to recognize all of the efforts that everyone does to keep our children safe. So if on April 1st, Friday, you are able to wear blue, we would appreciate that. You can post pictures of yourself on social media as a way also to bring recognition to the work that everyone's doing around prevention. Another opportunity that we have is we have a children's flag, and throughout the state of California, every county has a flag that honors children for the month of April, and we will be flying that flag at our building at the Margaret Dalton Children's Center over on Broadway, just down the street from the hospital. So if you drive by there, you can see it. And lastly, we created a couple of years ago through all of our partners, over 20 partners in the county working to prevent child abuse, a quilt made by Pat Bierk in Pioneer, and she put that together for us, that shows all of the efforts that everyone is making around preventing child abuse in this county. And we had it on the agenda to have it approved to display in this building a couple of years ago. Unfortunately, COVID changed the whole trajectory of everything we were doing a couple of years ago, and we had to pivot all of our activities since everybody went home. So this year, hoping that we can then display that quilt this year for the month of April in this building. And then we will be showcasing that quilt, taking it around to different locations throughout the county with all of our different partners, and having it at the county fair this summer, and then displaying it permanently in our building for all of those to see as they come visit our buildings. So,
questions from the board?
Well, I very much appreciate the displays that you guys have put out between here and Calaveras County. It's wonderful to see between the two counties that you've done.
great, thank you.
I just had a comment. I still have my pin on from last year, so I'm good to go.
Great, thank you so much. We appreciate it.
Yes.
I think you delivered some new pins to us last week too.
I did, yes, just in case, to make sure.
All right. Any more board questions or comments? I think the quilt is a great idea to bring more attention to it in the pinwheels, but before the board takes action, I'm going to ask for any public comments. Good, nobody's opposed to it. Hard to oppose an item like this because it's so important, so.
Thank you.
All right, board members, I need a motion on, we can do this together, I believe, the quilt and placing the pinwheels out front.
So moved. Second. Okay.
Moved by Supervisor Cruz, second by Supervisor Ornetto to approve this action. Any further discussion? All those in favor?
Aye.
All opposed? Motion carries. Thank you, Tracy.
Thank you very much.
All right. On to item 4C, American Legion Auxiliary, presentation of a resolution proclaiming the month of May 2022 as Poppy Month in tribute to those who have made the ultimate sacrifice for our freedom. Is there any representative here from the auxiliary? Yes, come on up, ma'am. Good morning. Would you like to say a few words, introduce yourself and say a few words before I read the resolution?
Okay, so I'm Linda Backus from the American Legion.
Hold that microphone right over in
Oh.
front of you. Thank you.
Can you hear me now?
Yes.
I'm Linda Backus from the American Legion, and they asked me to come and represent Post 108, to claim that, for May, Poppy Month. And so what we do is, I need your permission so that we can go to the different establishments and put our table up and, give out our poppies. And it's not a required donation, but we'd love to have a donation. And then we use the funds to represent our veterans in the county. And, like for the homeless, veterans, we do, a food drive, and, then Veterans Day Parade. We, have, our meal and, people that want to donate. And so we would just appreciate if you would okay us to have month of May for the poppies to represent our fallen veterans.
Any questions?
Another good project.
I'm going to go ahead and read the resolution.
Okay.
Whereas America is the land of freedom, preserved and protected willingly and freely by citizen soldiers, and whereas millions who have answered the call to arms have died on the field of battle, and whereas a nation at peace must be reminded of the price of war and the debt owed to those who have died in war, and whereas the red poppy has been designated as a symbol of sacrifice of lives in all wars, and whereas the American Legion Auxiliary has pledged to remind America annually of this debt through the distribution of the memorial flower. And be it resolved, the Board of Supervisors will approve this proclamation on this day to declare this month, May 2022, as Poppy Month. So with that, I would ask the board for a motion.
Move to approve.
Second.
Moved by Supervisor Brown, second by Supervisor Axe to approve the resolution. Any discussion? Any public comment? All those in favor?
Aye.
Aye.
Thank you very much.
Thank you, Lynn.
Get you with this resolution.
We appreciate your efforts.
Thanks.
All right, we'll move on with our regular agenda now. Item 4D, Amador County Senior Center, discussion of possible action relative to a presentation by Mr. Chris Carlton, the Executive Director of the Senior Center, relative to an update about the home delivered meals program. Morning, Chris.
Good morning, gentlemen. How
Morning.
Morning. Morning, Chris. I want to thank you for giving me the opportunity to give you an update on our home delivered meals program, which the county had decided to start funding last year per our request. So I thought I'd bring you an update on what we've done with what you have helped with over this last year. So first of all, I wanted to just give you an overview of kind of what our organization exists for, why we exist. And that is to support the independence and well-being of older adults in this county through advocacy, support services, education, and activities. Our home delivered meal program is a support service that we provide to homebound clients. And the goals of the program are really fourfold. They are to provide nutritional meals that are dietitian reviewed, freshly prepared, delivered daily with weekend options. So we provide 7 days a week for seniors with delivery of the weekend meals on Fridays. So our goal is to provide a meal that's not only nutritious to seniors, but really provides for their well-being and the social interaction that takes place between our volunteer drivers, our staff, and the clients themselves. But the meal delivery is more than just a meal. I think quite often people will assume that we're just providing for the nutritional needs of a senior rather than other needs as well. But there are a myriad of other needs that we really provide when we provide for the meal. So we call this more than a meal when we do this delivery. It provides a daily welfare check for seniors. Every single day they have contact with somebody so that we know that they're okay. If they don't come to the door, that's alarming to us, and then we have protocol in place for contacting emergency contacts and then ultimately local authorities should that person be unresponsive to our driver's attempted delivery. So well-being and wellness check are a big part of this program. Also, the social interaction that takes place between our volunteer drivers, our staff, and the clients themselves. There's one client who just talked to me this week and said, the highlight of my day, if you can imagine, the highlight of my day is when my driver comes with my meal. And a lot of us, I think, struggle to imagine that being the highlight of our day. But for an older adult who's isolated and homebound, that is the highlight of their day. And so it makes our drivers smile. The improved mental and emotional health that comes with that social interaction is really important. As you recall, Cap Radio did a research project on Amador and really focused in on suicide. And 1/3 of all suicides within Amador County are older adults. And the idea is that the reasons behind these tendencies is because of isolation and loneliness. So our home delivered meal program does more than just provide meals. It provides connection for people. And it also provides access to resources. We resource our home delivered clients not only with available exercise programs by Zoom, we resource them with the county resources that behavioral health offers. If we notice depression, we notice anxiety, we'll make a referral to behavioral health. So helping people have access to resources is really important. Connection to our peer visitor program, connection to our new pet program, which I'll talk about here in a few moments, to help provide support for seniors' pets. But every meal literally delivered is one less demand on county resources. So when you fund this program, know that you are helping to alleviate the strain on other county resources because we're there interacting with clients every single day. A research project took place in 2013 between Meals on Wheels America and Brown University and AARP. And the research project, the results were released in 2015 out of this 15-week study. And what they found was that those who were 60 plus receiving daily meals versus weekly frozen meals and then those on a wait list was actually pretty profound. And here are the results of that research. The results of that research showed that those who received a daily hot meal versus a weekly frozen meal experienced the greatest improvements in health and quality of life indicators. The research also showed that it reported greater benefits from the home delivered experience to the older adult and improvements in feelings of isolation and loneliness for those who received a daily hot meal versus a frozen meal weekly or being on a wait list with the hopes of receiving a meal at some point. We started this program, we always had it sort of as part of our idea to eventually roll out, but COVID really became the catalyst for us to sort of get our efforts behind launching this program. And so 3 months into COVID in May 2020, we launched this program, and that's when I came to you to request some support for that. But to keep the costs really low, we've had to reach out to receive different revenue streams, one of which has been the county. To give you an idea of what we look to receive from seniors as far as financial support, we ask for a $4 to $6 contribution per meal. Now, if you've been to McDonald's recently and ordered a number 3, you're probably going to pay $10, $10.50. So you can imagine the effort we have to make as a nonprofit to make a $4 meal work. We charge between $4 and $6 for these meals to help offset costs, obviously. And the reason there's a gamut is we've put in place a financial needs assessment. So when a client fills out an application, they self-disclose their income as well as their expenses. And then we look at bank records if they want to go further with the discount. We've gone so far to sit with seniors who have said they can't even afford the $4. And there are a small handful, I'd say 3 in total, it may be 2 now at this point, that we actually deliver meals for free to, because they honestly have more outflow than they have income. I don't know what that means for their future, but in looking at one client here recently, her husband had passed away and left a small savings account. She showed how much her space rental was for her mobile home. She evidenced how much her additional insurance was, as well as her prescription medication costs. And she had a deficit every month. And that deficit was being covered from this small savings account that her husband left her. I don't know when that runs out, but so that we don't put a strain on that account, we've been delivering meals to her completely free of charge. And so we go into the community and we attempt to raise money to offset these costs. So for $4 to $6 for a hot delivered meal with the gas prices we're facing, you can imagine the increased inflationary costs we're seeing, along with the supply chain challenges that we've been facing. We've had to use 3 different food suppliers because one will have one item and the other will have a different item because the other one doesn't have the item we need. So we've actually had to increase our vendor list to make sure we can continue to provide the meals that we do. I want to give you an update on the program with some exciting statistics. As of July 1st, which was the beginning of our fiscal year in which your funding came into place and helping our program thrive, we added 50 new clients since July 1st to today. And I want to give you the client locations. I don't see the PowerPoint catching up with me. That's okay. Hopefully you'll remember these numbers. July 1st through March 31st, and I can say through March 31st, even though it's not the end of the month, because we know how many clients we're going to serve in the remaining week or so of March. We have 43 clients in Ione. We have 63 clients in Jackson, 20 in Pine Grove, which is where we've been expanding the most, and 27 in Sutter Creek. So we have 153 total clients since we launched this program. And you can see that about half of those have been added just in this fiscal year as we've expanded the program. Yes.
What about places like Plymouth and River Pines?
Yeah, that's a great question. So we've been growing this program and launching this program in local communities that we think we can do delivery and sustain services toward.
Okay.
I think my biggest fear as an executive director is to overpromise and underdeliver. And so we don't want to say we're going into a community and then not be able to do it with the infrastructure we have. So after having launched this about 20 months ago, we chose to very strategically launch into certain areas. And we started with the city of Jackson because that's where our center is located, and then move into Ione, and then Sutter Creek. Now Pine Grove, we're pushing up 88 corridor, and we hope to be pushing even further up there. Plymouth is on our radar. We hope to do that. But part of what's going to help us with that isn't just, I would say the most important part of our infrastructure is honestly our volunteer base. So the reason we were able to go into Ione so quickly is we had an individual from Ione say, when you get this program off the ground, I will deliver every single day. Well, that's easy. The delivery is the hard part, right? So we had a volunteer say, I will deliver every single day, and he has done that every single day since we launched that program. So Ione was very easy to permeate. If we had a volunteer today, say from Plymouth, I can do 3 days a week delivery, and we had another volunteer say I can do the other 2 days, we'd launch tomorrow. So that's the biggest thing, is how do we grow our service area without crippling our organization, our financial structure, making sure we have the staff in place to handle it. We just hired a month ago a new program coordinator who is fully 100% focused on homebound seniors. So not only does the homebound lunch program fit within that person's purview, but they're also going to be focused on how all the other things I was talking about, how to resource those seniors, how to connect them with a visitor, how to make sure they're connected to exercise programs, our grab bar programs, those sorts of things. So when we go into an area, we want to make sure we can provide those services. So that's the answer, I guess, to your question. You have any follow-up on that?
No, I mean, that makes a lot of sense, that, you know, you're just gonna kind of creep up on, you know, take the opportunities when they come and expand when it makes sense.
Right, and I think, again, doing that in an inflationary time is very difficult. We're again, we don't want to overpromise and underdeliver. So we promised seniors when we started this in May of 2020 that we're going to be there for you. I know that they're looking at the inflationary costs and considering those in their own lives. We're attempting to not move up that $4 to $6 fee that we charge per meal. We're actually going out and attempting to find more revenue streams. So Area 12 has their home delivered contract up for bid. The RFPs due this Friday. I'm in the middle of writing that RFP. We're going to attempt to get that contract for home delivered meals here in Amador County because we believe we can provide a very good service. That will allow us potentially to expand to Plymouth as well.
You know, a question on that. As far as, how have you done outreach as far as trying to recruit drivers?
So we have multiple ads that are running in not only the Mountain Merchant, but one that rotates in the Ledger Dispatch. I'm on the radio every single month. KVGC has been a huge partner of ours in even not only, and I don't want to say this like we're getting a lot of free stuff. We do have a good ad package that we purchase from them, but even during the news and such, if you listen in the morning, they're constantly promoting this program. Jim Geedy has been a huge partner with us, and actually recently, as his life has had to sort of slow down for personal reasons, he's been doing deliveries, and he's been talking about it on air. So we've got a lot of exposure, and we continue to ask for volunteers to step up and help us make these deliveries. We do offer to volunteers, anyone that's listening to even this meeting who's interested in volunteering, we offer stipends for gas, and we offer gas cards. We offer some support. We even have 3 vehicles now. In fact, I wrote a grant through Meals on Wheels America at the end of last fiscal year, and in September we took delivery of a 2015 Subaru Forester so that we could move up country, completely paid for by Meals on Wheels. So they gave us a $20,000 grant for that. We have 3 vehicles. We just need volunteers.
Because sometimes you see some of those deals, like there's what, Nextdoor, and then there's Facebook, of course, where a lot of people do chatter on there.
Yeah. So we're a senior center, so social media is a bit of a challenge for us. We've finally mastered Facebook. We've moved into Instagram, and I think our next move is going to be into Nextdoor. But currently, we run ads on Facebook. We promote as much as we can. Whenever I'm out publicly, I talk very clearly about the need for volunteers, and our expansion will be completely based upon the need for volunteers. As I said, we just hired a program coordinator fully focused on homebound seniors, but that individual can only get in 1 car and go to 1 location. That individual could not possibly deliver to this entire county in 1 day. We have a 2-hour window to deliver that hot lunch because it's beginning to cool down. Even though we have warmers and cold packs, it becomes dangerous after a certain period of time. The last thing we want is any blowback on us for, you know, food poisoning or something.
Plus, I get in trouble with my mother-in-law sometimes because she's older and she wants a hamburger or something from town, you know, but by the time you get from town to my house, sometimes she's not happy because it's kind of cold.
Right. Not
cold, but
sure.
Not to her standards.
Yeah. So we have a 2-hour time window we get those meals delivered toward.
Chris, I have
Yes.
2 questions for you. You said you deliver hot meals every day. What about weekends? Is that included too?
So the weekends are included, and they have that option. The clients, by the way, can participate in any level of service they want. So if they want to take delivery just on Mondays, they can do that. If they have children that come in out of town on weekends, they don't have to take the weekend delivery. We do ask that they fill out a menu a month ahead of time so that we know what we're doing and we know what we're going to have to do as far as a certain week is concerned. Weekend meals are optional, and they can take them. We deliver them on Fridays. So on Friday, you receive a hot meal for the day, and then you receive 2 meals in a cold pack, so they can be reheated. They're not frozen, but they just need to be reheated.
Okay, and let's see those commercials on TV every once in a while for $2 a day, you can support this child or whatever. So if you were going to put that in dollars, those individuals that cannot afford meals at all, what would that cost come out to in a year? $500, $1,000?
It would depend on how much we considered all of the overhead the senior center faces. So if it's simply food costs, it costs us $5.60 per meal just in food costs. Then if you were to add in utilities and staff time and all of the other expenses, retirement for staff, I mean, all of those things that get considered in an expense, you're probably looking at $13 to $14 per meal in true cost to the center.
All right, thank you.
Yeah, you're welcome. So just to wrap up, since July 1st through March 31st, and again, I can say through the end of March because we know who's going to be ordering the rest of the month, we will have delivered 3,538 meals to Ione, 5,053 to Jackson, 1,077 to Pine Grove, 2,004 meals to Sutter Creek for a total of 11,672 meals between July 1st and today. So we will obviously be, I would say, somewhere in the 15,000 meal range or above by the end of the year, and that's just home delivered. That's not even counting our drive-through / congregate meal service we've been doing as well. I wanted to also give to you a little bit of information around our volunteer hours. By the end of March, there will be 921.58 volunteer hours that will have gone into this home delivered program, which at $15 an hour, which is a pretty low wage, but if you just were to take a minimum wage of 14 in California and bump somebody up $1 and say that's what we pay our volunteers to deliver meals, that value is $13,823 to us as a center. So you can see why volunteerism is so important to this program to help make it feasible so that we can continue running it. I want to leave you with a story, and then I'll take any more questions that you might have. In March 2020, obviously our lives were changed when COVID came on the scene. The Senior Center was forced to close on March 14th of 2020 to all activity, including meal programs. We then, by May, had launched this home delivered meal program somewhat in response to the COVID epidemic, alongside of being our general plan anyway for the future. All of our congregate programs became a drive-through program, so seniors would come through. There was an individual who started the program around the end of March, and his name was Stan. And Stan came through the meal program because his wife was at home and couldn't drive, and he was in his early 70s. He was concerned about the virus and how it would impact him, so he decided to become part of the drive-through program rather than go out to the store to buy groceries. Within 8 months of starting the program, we were friends with Stan, as we become friends with all of our clients. One day, Stan drove up, and he said that he was going to give the Senior Center's meals one more week opportunity because the night before he had been violently ill all evening. So of course, when we hear this, the wind is knocked out of us because we've never had a senior or an older adult complain of any food poisoning issue. We take a lot of pride in our meals. So it set us back a little bit. And he showed up the next day and he said, "I'm feeling better. I don't think it was the Senior Center meals." Well, when you have a foodborne illness, it's going to be more than one person who's sick. So we felt pretty confident after not receiving other complaints that he was fine. But he wasn't fine. Stan soon found out after visiting his doctor that he had incurable cancer. And it's what had been causing his illness. Stan passed away within 1 month of that diagnosis. Saying goodbye to our clients is some of the hardest things that we have to do. But the story doesn't end there because Stan's wife, Sally, was homebound and couldn't drive. Stan's biggest concern during that time was how his wife was going to be provided for after he was gone. Stan went on hospice that final month. We converted them over to the home delivered program, which was probably about 5 months old. Stan continued to share with our driver how grateful he was for the service, how he knew his wife would be cared for. And when Stan passed, we continued to care for his wife. We checked on her every day. We delivered a meal to her every day during the pandemic. I wish the story got more cheery from here, but it doesn't, because then soon Sally was diagnosed with an incurable illness. And about 6 months ago, we said goodbye to Sally as well. But here's the thing I can tell you. Here's the good news of this story. The Senior Center was there to provide for this couple. We were their only stopgap. And there are countless older adults out there just like this. Because the woman that I started this story off with, who said she's so grateful and the highlight of her day is to see our driver, she's somebody's mom. She's somebody's grandmother. And so, as I say and conclude this little presentation to you, who's going to care for your loved ones when you pass away? I think you would hope that there'd be a senior center like ours providing these kind of programs. And so I want you to know that as you continue to fund this program, and we're going to request again additional funding hopefully for this next year, that you think about those stories. You think about Stan, you think about Sally, because those are the faces behind the dollars you help our senior center with. And with that, gentlemen, I'm very grateful for the support you've given us. We're really grateful you make this program possible. As you consider the frozen meals versus the fresh meals, I would say that the county, and I'd like to point out to you, supports frozen meals in this county 3 times, with 3 times the amount of funding as you do the hot delivered meals the senior center provides. I'd ask you to reverse that. I'd ask you to think about the well-being and the effort we make and the good services we provide. I'd ask you to consider reversing that. Fund the daily hot meal at 3 times the cost, the frozen meal. And I think you'll see results in this county.
You should be looking over there too.
Chuck is my next conversation.
And you did about what, like 11,500 meals a year, was it roughly?
Oh, 9 months.
No, in 9 months.
9 months, okay.
Yeah, we'll be just over 15,000 meals.
The drivers that volunteer, are they required to go through background checks or anything else?
So we have a volunteer application they have to fill out, and there is a volunteer background check, but it's not like live scan or anything like that. It's simply just a background check to make sure that they are a good volunteer for us, and also we look at driving records as well. Any other questions?
Imagine your congregate meals are not open yet.
Hey, good news, gentlemen. Our congregate meals will open April 18th, finally, after 2 years. So we'll be open again. We'll be ending the drive-through program.
Actually, your food's, what I've been hearing, is rather good.
We make a lot of effort to provide a tasty meal, even though it has to meet nutritional requirements. Yes, thank you. I'm glad you got good feedback.
There's no further board questions. I'm going to ask for public comment at this time. If there's any questions or public comment. And hearing none, anyone on Zoom? Chris, thank you very much for being here and for the services you provide to the community and the seniors.
Thank you, supervisors.
So just to touch on what Chris mentioned, the $5,000 for the senior center is in the budget for 22-23. He's talking about the $15,000 that we give to Common Ground. So if the board wants to flip that, we can bring that back to a subsequent board meeting and talk about it and invite the senior or the Common Ground along and discuss how we want to allocate those funds.
I wouldn't mind looking at that. I'd like to see the numbers of meals that are provided for the dollars too.
I hate to put one in competition over another, and I think we can look at both and make some decisions.
Yeah.
Going forward. Okay. All right, thank you. And now we will move to item 4E, Area 12 on Aging, discussion and possible action relative to presentation by Ms. Chris McCoy, ADRC Program Manager, regarding the newly established Aging and Disability Resources Connection. Ms. Chris McCoy on Zoom.
Chris, you can go ahead when ready. Go ahead and unmute.
Okay, can you guys hear me now?
Yes.
Yep.
Good morning.
Okay, good morning, everyone. Good morning, supervisors. Good morning, audience, and good morning, everyone on Zoom. So if we could go ahead and start that slideshow. As you guys heard, I am Chris McCoy. I am the ADRC Program Manager for Area 12 Agency on Aging and our new ADRC of the Motherlode. Go back a couple slides. Okay, so we can start here, or that's fine too. What does ADRC mean? Aging Disability Resource Connection. This is a concept that the United States actually came up with. There are several ADRCs across the country, and then the state of California decided that they wanted to start creating ADRCs. So Aging Disability Resource Connection, what does that make up for an ADRC? Next slide, please. To make an ADRC, you need to have two core partners. You need to have one that is an area agency on aging because they deal with aging people, correct? And then you also need to have an independent living center or an ILC. So for our ADRC, our core partners are, of course, Area 12 Agency on Aging and DRAIL, Disability Resources Agency for Independent Living. That's what makes up our ADRC. This way, we now can expand who we're helping from not just aging, but also disabled as well. And we partner together to create this ADRC and be able to help both sides of those communities. Next slide, please. So what does an ADRC do? Well, we assist consumers, regardless of age, disability, or income, in making decisions by delivering the right information at the right time of available long-term supports and services. Oh, go back to, sorry, back one more. There we go. For the consumer's choice of care. So we're providing long-term supports and services to those aging and disabled. We're giving them those referrals, those programs out there that are available to them in what they need. So if we can go to the no wrong door slide, next slide, please. How do we do that? We provide a no wrong door system. So in providing a no wrong door system, we're going to aim to minimize that confusion, streamline that access through a single reliable source, be that Area 12, or be that DRAIL, or be that any of our extended partners that we'll be working on. They come into that door, we help them no matter what. We get their story, we send them where we need to get the programs and services that they need, and they don't have to tell their story 100 times to 100 different people. It's a highly integrated network of various community-based organizations and extended partners, which we'll talk about in a minute. And of course, people of all ages, incomes, and disabilities receive the access to the same information regardless of which door they've entered. So they can enter Area 12's door, but it might be a disability related item. We would then refer to DRAIL, share that information because we've got a memorandum of understanding between us. We can share that information with DRAIL and say, hey, Mr. Smith needs this information that you're an expert at. And then DRAIL can step in and do that. And now Mr. Smith hasn't had to tell his story 100 times. We haven't just given him a number and let him go off and try to figure it out on his own. We've actually helped him to make that connection. Next slide, please. So this graphic kind of shows before a no wrong door system is implemented, it's kind of chaotic, as you can see by the picture. But after a no wrong door system is implemented, then we've put that person in the center, and now all of us as core partners, as extended partners, are now working together to get that person the information, the programs, the services that they need. So that's what happens with the no wrong door system, and that's what we're implementing as an ADRC. Next slide, please. So one other thing that we offer as an ADRC is a person-centered practice. What's that about? If you've ever heard the terms options counseling or person-centered practices, it's basically helping a person to navigate those systems and they choose through self-determination what programs and services they need. They make those selections. We don't force them to make choices. We give them their options, and then they choose what services they need, what services they'd like to be put in touch with. We use warm handoffs between us and, say, the core partner, or us and the extended partner, as I was talking about earlier with referring Mr. Smith over to Drail. We're going to warm hand him off. We're not just going to hand him a phone number and go, here, go call Drail. We're going to actually hand him off to Drail, and Drail's then going to step in and help with the areas of expertise that they have. And vice versa. If someone entered Drail's door, same concept, and they needed some aging services, Drail would do this, take the story, figure out what they need, warm hand them off to us, and then we could put them in touch with those services and programs that they need. We also develop culturally competent care plans with them. We streamline access to those long-term supports and services. We build dynamic relationships to support the person's transition, whichever transition they're making, and we focus on the person. That's the most important key piece to this. We focus on the person. The goal is to support their decisions about where and how they wish to live. Next slide, please. So on the next slide, when it gets there, you'll see, so there are 4 core services that we have to provide as an ADRC. In order to become designated, we had to prove that we could provide these things. The very first one is enhanced information and referral services. We have information and assistance at Area 12. Drail also has information and assistance, but what about enhanced information and assistance? Are we available 24/7, 365 for a consumer who needs a referral or needs to know about a program or service? Unfortunately, no, we are 8 to 5. So how do we enhance information and assistance to them? We're going to talk about that in my next slide in just a bit. But basically what we did was build an online resource directory. So we'll come to that in just a minute. The second core service we have to offer is options counseling, which we just talked about, that person-centered practice, making sure that they have all of their resources and they choose which ones they would like to have. Short-term service coordination and transition services. Those are the other 2 core services we have to offer. This is where our partner Drail comes in really handy, because this is the areas that they are experts in. They have the funding for short-term service coordination. What is short-term service coordination? It is where in urgent situations, someone needs to transition, say, from a rehab facility to home, and they need a temporary ramp while they recover. What is transition services? It's a more long-term type service. That's where someone's transitioning from a hospital to home or a skilled nursing facility to home, and they actually need that permanent ramp. They need one that needs to be permanently built. That's where Drail's funding and their expertise comes into play. And those are the other 2 core services that we had to offer. So that's why the state really wanted the area agencies on aging and the independent living centers to really work together. One, to help all of the aging, all of the disabled, and also because we each have our areas of expertise that we bring to the table. That's what makes up an ADRC. Next slide, please. All right, so we talked about that enhanced information and assistance. So this is probably the most exciting part of our ADRC. We developed an online resource directory. As Area 12 Agency on Aging, we cover 5 counties. We cover Alpine, Amador, Calaveras, Mariposa, and Tuolumne counties. As Drail, they cover actually 7 counties. But the commonality between us for the ADRC piece is the 4 counties that we share in combination. So those 4 counties are actually Amador, Calaveras, Mariposa, and Tuolumne counties. So our ADRC covers those 4, but when we built the resource directory, we did go ahead and include Alpine as well. So this is our online resource directory. The address is there. The QR code does work if you want to hold your phone over the QR code. It takes you straight to our resource directory. That resource directory is information on every possible product, possible program, service, everything we could find with regards to seniors and disabled in all of those counties. So it's a comprehensive, hopefully user-friendly. That's the way we designed it, to be able to, for family members to be able to go online if they needed to and look up a type of program or service that they're looking for. Say they needed a ramp, they could go there and look and type in ramp, and it will give them all the resources for all 5 counties. Then they can then narrow down that search to their own county if they needed to. So this is our online resource directory. This took about 18 months to develop, and it is up and running. And I hope that you guys will go check it out. Next slide, please. And so for our next step in our ADRC, as you guys know, we recently got designated by the state. So we've met the 4 core services. And our next step is now to start building our extended partners. So we're now going to start reaching out to all or some of these agencies that are listed here and get them involved in our extended partnership. What that does is it brings us back to that picture that I showed you, where a no wrong door system, and we've got all the agencies around the person helping the person. It's going to involve creating MOUs, memorandums of understanding between each of us, and be able to share information securely so that we can then start helping these people as needed without having to just give them a number and hope that they call. We're actually going to do those warm handoffs, share that information, put them in touch with someone at our extended partner, and then they get those services that much quicker, that much more efficiently. So this will be our next step that we will be doing. Next slide, please. So lastly, I just want to summarize, who do ADRCs benefit? Well, they benefit everyone. They benefit anyone that's aging, anyone that's disabled, anyone needing those long-term supports and services. The reason that it's successful for them or benefits them is because it's consumer driven. We're putting them in the center. We're letting them make the choices on what programs and services they need. It's more efficient because we've got those extended partners and we're sharing information and getting them those services more efficiently. It's more cost effective and there's better outcomes for the consumer. Next slide, please. And with that, I will turn it back over to the board or the audience. Any questions that you have for me? That is our ADRC of the Motherlode.
Supervisor X.
Yes, Chris, this is Supervisor X. So the best way for a consumer, if that's the correct term to apply, to get involved is to go to your online resource directory and begin the process that way, or are there multiple ways of doing that and finding out what kind of services are available, or is this being publicized through local aging areas on senior centers? Can you kind of elaborate on that for me, please?
Absolutely. Thank you for that question. Yes. So there's a multitude of ways they can get started with us. They can call us here at Area 12 and seek those services. If it's between 8 and 5, we are absolutely here to answer the phone and help them to find the resources that they need. They can call DRAIL. They can use our online resource directory if their skills allow and they can get on a computer and use that. They can certainly use that. But it's not any one of those options is absolutely possible. They can contact us, they can go through our online resource directory, they can go through Drail, they can go through anyone to get to us. We do have an information space on our webpage where they can also send us questions via the webpage. Our online resource directory, to answer your question on advertising, it is being advertised on our webpage, our Facebook page, Drail's webpage, their Facebook and Instagram pages. We have sent flyers out for the resource directory to all of the senior centers in all 4 counties. And we've also advertised in the newspaper, on the radio, and we're continuing to do all of those efforts to try to get the word out.
Okay, just to follow up, Chris, so when you say your webpage, is that Area 12's webpage?
Yes, Area 12's website address and Drail's website address.
Oh, okay, both.
Any other board questions?
Yep, it's advertised on both. Yep.
Chris, this is Richard Forrester. I have a question for you. I've sat on Area 12 on Aging for many years, and they do a great job helping seniors. My question is, how much overlap is there between the Resource Connection and Drail?
So if I'm understanding your question correctly, there's quite a bit of overlap. We're working hand in hand with Drail now because that's part of our ADRC is that they're our core partner. So we are working hand in hand with them. I don't know if I'm answering your question completely, but to give you an example, we actually did 3. So Drail is responsible for helping to get batteries out, Yeti batteries out for power safety shutoffs for PG&E. And so we actually partnered with them the end of last year, and we helped them to, 1, get applications. So we contacted all of our consumers that could possibly need a battery during a PSPS event. And then we filled out the applications, we got them to Drail. Then Drail and us, we both worked together to actually do distribution events. We did 3 events. We did one in Amador, one in Mariposa, and one in Tuolumne counties. And we actually handed those batteries out at the senior centers in those 3 counties and got batteries out. Then for those that were homebound, unfortunately, there was a little bit of a battery shortage for a bit, but now Drail is actually working on delivering those batteries out to the homebound consumers that we had as well. So now those are now getting delivered out. So we work hand in hand with Drail on a lot of different projects because the ADRC we're partners in the ADRC. Does that answer your question?
I think the partnerships are great. And you said there was quite a bit of overlap. I'm a little bit concerned that we're using a lot of resources on the overlap where we might be able to thin that down to having multiple agencies involved and multiple personnel sometimes doing the same things may not be the most efficient way to do it.
Well, and hopefully with our extended partnerships and starting to develop those as well, we will make it more efficient because now we're, if that consumer comes in our door as Area 12, we take their information, we get their story, we turn around and then we connect them with, say, Drail or say the Amador Senior Center for Meals on Wheels. We connect them with those things, and we've already done the intake, the assessment to some degree. If we've got a shared intake and assessment, which we are working on, then we've done that piece for them. We've now handed it to them and said, hey, here's Mr. Smith, here's his intake and assessment. Then hopefully there's a minimal amount of information that then that aid partner agency will have to get to finish that process and get that person connected with their program, because we've already done most of the work from one agency to another.
All right, thank you. I mean, that's where I'd focus, is trying to make it as efficient as possible, because as you know, with Area 12, the dollars are very thin sometimes.
Yes, absolutely, sir.
Any other board comments? And we'll go to public comment. Any public comment? Anyone on Zoom? All right, Chris, thank you very much for the presentation today.
Thank you guys for the opportunity, and I hope to see you guys soon with some good news and how everything's working.
All right, thank you.
Thanks.
All right, we'll move on to our next item, 4F, update regarding the No Place Like Home project being funded by the state of California. And with this, Melissa? And I guess it'll be Melissa and Supervisors Crew and Axe, who sit on the homeless task force, probably putting the input in. So, good morning.
Good morning.
Morning.
There is a PowerPoint.
I think we have
We
lots.
actually have, there's two.
We have lots of PowerPoints.
I know, sorry, lots of info. The one that Danco's actually, I'm gonna do a brief introduction and then, Danco's on Zoom and then they'll do their presentation.
Okay.
So there should have been another one that was sent that, looks like this. It's okay, if you don't have it, I could just,
Did you email it?
yeah, I think,
It's on the agenda.
Okay, I'll find it.
You got it somewhere.
well, I guess I could just go ahead and, get started while she's getting it up there. So good morning, I'm Melissa Cranfield, the Behavioral Health
Morning.
Director. And we're here today to give an update on No Place Like Home, our permanent supportive housing project update. So today we just want to do that, kind of a brief history to kind of catch everybody up of what we've done until today. Some permanent supportive FAQs, because there are some questions about really what is permanent supportive housing, so just a few things to touch on there. And then updates on the No Place Like Home project, where we're at in terms of applying for the funding and the next steps in the project. And then I'll turn it over to Danco so they can do their presentation about where they're at. So we've been working on No Place Like Home for a few years now. So No Place Like Home is funding that comes from our Mental Health Services Act funds, and it's to provide permanent supportive housing for folks who have previously experienced homelessness and struggle with mental health conditions. So in 2019, Amador County had hired Housing Tools using a technical assistance grant for the No Place Like Home funds. Those are the folks that you've seen with us at other presentations that have helped us do this, because at behavioral health, we're not experts in housing, so we needed that support. In 2020, we worked with Housing Tools and the Homeless Task Force to prepare the 10-year plan to address homelessness. And we brought that to the board as well. And then last year, we did the request for qualifications for a development sponsor, and that's how we got Danco Communities on board with us as well. Yep, this is it. You can go to the next one. All right, and we also here's just a message of support from a couple of folks that participate in the Homeless Task Force. And then, so for permanent...
Hold on a second.
Oh.
Can we put that on full screen? No? Okay, Barbara, go ahead.
Oh, technology, right? So permanent supportive housing facts. So these are questions that seem to come up a lot, is what actually is permanent supportive housing? So permanent affordable housing with wraparound supportive services that assist residents living independently and meeting their goals. A huge part of the permanent supportive housing is, the key is supportive. So for these projects through No Place Like Home, we have to submit a supportive services plan. And it is a very comprehensive and extensive plan to provide case management services, wraparound-like services to the residents that are in the No Place Like Home units. And Dan will explain later, it's a bigger project and a portion of those are the No Place Like Home units. So we would have our case managers that would be going there on a daily basis. We would have our mobile support team could go there at any time in addition if there were other issues. We would also have, part of our supportive services plan is also to have clinicians going there to offer groups, substance use disorder counselors there to offer groups and services, partner with other agencies in the county to come there to provide services. So a lot of it is helping to bring services to the residents, but then also helping to transport and get them to the services that they need. So it's not just, you know, kind of letting them figure it out on their own. It's really providing a lot of supportive services to ensure that that the housing continues to be permanent and that they're successful.
Every time you provide services, that means more money. So is that included in the money that's allocated from the state?
The supportive services would be provided by behavioral health, which were funded by Medi-Cal and Realignment and MHSA. So the services we provide would come from those separate funds. And what is not permanent supportive housing? It's not temporary housing, it's not transitional, it's not a shelter, it's not rapid rehousing. And so I think this is sometimes there's confusion about permanent supportive housing, that it's more of a temporary short-term solution, but that's not how it is intended. It's supposed to be something that's permanent and supportive, so people, this could be a forever home for people.
Yeah, your double knots are almost confusing.
Sorry.
Almost a positive.
It is positive in there. So what does the data tell us about permanent supportive housing? Residents are more likely to remain stably housed and less likely to use emergency services, which benefits the greater community. So that's part of that supportive services plan, to ensure that people have what they need so we can reduce the amount of emergency services. And do residents pay rent and have a lease? Yes, they do. And who will live in the Amador County No Place Like Home project? The project will have a mix of supportive housing units for people previously experiencing homelessness, as well as general affordable housing units available to people who qualify based on income. So Danco will go into that a little bit more, but there'll be a combination of the units that are the No Place Like Home units and then just affordable housing units.
What does that mean for people previously experiencing homelessness? So those people then eligible to live here have transitioned out of homelessness before they get to the point of being a resident of this facility?
Right, right. And then the next...
Well, Melissa, but some of these people that qualify for the No Place Like Home potentially would have a mental health condition and may have never really been homeless.
Right.
But are at risk of...
Yeah, they could be at risk of homelessness due to their mental health condition, yes. So they may be previously homeless, or they may be at risk of homelessness.
What's the ratio? Is there any set ratio as far as what units are which?
Yes, there is. There's a certain, I think it's the 46, and Chris will go into this more when he talks from Danco, but I believe the total project proposed is 46 units, with 22 of those units being for the No Place Like Home units, so the rest would be affordable housing. Okay, and then on the next slide, it gives just actually a lot of information about the supportive services. I kind of went over that with the case management. When we applied for the competitive funds for No Place Like Home, it was a very extensive, comprehensive supportive services plan that we had to submit to the state. But this gives you kind of an idea of all the services that we are required to provide with this funding. And then there's also an on-site property management, and that will be, Danco will be responsible for that, and they have an agency that they work with that will provide services as well for the entire project, and they'll go into more detail about that when he presents. I have another message of support from a resident of Sutter Creek. And so for our updates in November, after the joint presentation, this is when we had the two resolutions to apply for the non-competitive funds that were reserved for the county. And then the county and Danco ended up applying for the competitive allocation, which is just under 8 million. And we sent that application in at the end of January. And the State Department of Housing and Community Development is expected to send those award letters by June. So hopefully by June, we will have an answer if we were awarded those funds. And I think now it's time for Danco's presentation. And I believe Chris and Mandy are on Zoom.
Are they gonna share their screens? Or do we need to?
Ready to?
Can share.
There we go. Can you all hear me?
Yes.
I can share my screen if that's okay with everyone. I'd
Yeah,
love to do
that would be easiest.
Okay. I'm gonna do it. Let's see. Let's see. All right. You should be able to see a building. Can you all see that?
Yes.
Yes.
Great. Well, good morning, everyone. Thank you
Morning.
for allowing us the opportunity to give an update on the permanent supportive housing project that Melissa was discussing with you. We're happy to be here today. This is my third time presenting to the board. Apologize, wasn't able to be there in person today, but nevertheless appreciate the opportunity to present and give you an update. I think our objective today would be to give you an update on the project. I know that I've already presented some of our past projects, but I think there's some new people in the audience and that maybe haven't seen those. So I'm going to go through those. And then I think Melissa did a good job explaining what is permanent supportive housing, but I can add on to that. And then answer questions. For those who are hearing for the first time, just the background here is that, as I think Melissa went into this a bit, but Housing Tools was retained by the county to procure a development partner. We being Danco, responded to an RFP and were selected as the county's development partner. And we've been working collaboratively with behavioral health and Housing Tools staff for well over a year now, which has brought us to this point. So just an update on the project itself. What we've designed here so far, and we have one submittal into the city of Center Creek, and then had some responses and are getting another submittal responded to. Basically, the property is located on the corner of Bowers Road and Valley View Way. It is currently designed at 46 units. 22 of those units, as was mentioned, we applied for the No Place Like Home funds as co-applicants with county behavioral health and through the No Place Like Home program process through HCD, or Housing and Community Development. The project will have the county will be providing case management to the project, as mentioned, and then we will have all the other units, or the entire property. There will be a resident service coordinator that stays on site and provides housing to or services to all the residents that are on site. So the 22 of the other units plus a manager's unit, which would be on site there, would be the other units. This just gives you an idea of the elevations as they're coming to life, of kind of what the building would look like. You can see it's just two-story construction, mostly two-story construction, and just traditional multifamily apartment buildings. And going into a few other projects we've done, just to give you an example of other projects that we've currently done, so you have some background on what we do. This is not our first project. We have many permit supportive housing projects throughout the state. This one is an example. This is our most current project that we're just finishing up in Santa Rosa, called Sage Commons. We just actually moved the residents in last week, which was exciting for the 54 units it is, all the people that were able to move in. This project is 100% supportive housing, so all 54 units are for folks that have been previously homeless. It's a mix of studios, 1s and 2s, has a large meeting room, recreation room, bike area, garden plots. It's really close to the SMART station, so it has access to rail, and then also close to a major transit stop. And this project is done similar in that it's a partnership between Danco and the County of Sonoma's behavioral health. So if you're interested to hear more about it, you could talk to some of the folks at Behavioral Health, County of Sonoma, or myself, give you more information. This is our latest. This project here is in Gilroy, California, that we have. It's been in service now for about 2.5 years. It's 75 units for seniors, and similar to what we have planned in Sutter Creek. 50% of these units are for those who had previously experienced homelessness, and the other 50% are just general affordable, but all for seniors, so you have to be 62 and older. And the supportive service side is in partnership with the County of Santa Clara Housing Authority and the Office of Supportive Housing. This is a project that we did in Eureka, California, which we, in partnership with the City of Eureka, we call it Bayview Heights. This project is 51 units, and it was for homeless veterans. And this is 100% supportive services. So in order to qualify, you had to have a previously homeless or at-risk status to move in. And this project also has No Place Like Home funds, and is in partnership with City of Eureka and the County of Humboldt Behavioral Health, and the City of Eureka's, County of Humboldt Housing Authority. And then finally, on the projects side, this is River Bluff Cottages, which is located in Rio Dale, California. It's a little bit different in that it's cottage style. So there's 26 cottages on site. It's been placed in service now for about 1.5 years. It's 100% supportive housing as well, and also in partnership with the County of Humboldt Supportive Services. So I think Melissa did a good job talking about what is supportive housing. I did have a little bit on that. You know, and I think the way to think about it is it is independent living. It's multifamily housing. The services are there, the wraparound services are there to keep the residents in housing. You know, it's not assisted living, it's not a licensed residential care facility. It's really a multifamily housing project where there are services provided to the residents, and those services are done on site in the community room. So our community space will be, you know, it'll have a large meeting room. It will have private meeting offices. It'll have, you know, a space for group meetings, group counseling meetings, and also individual privacy meetings, as well as, you know, just general recreation that you would do in a community space. The residents that are, as Melissa spoke, the residents that are for the No Place Like Home units, they have to go through the coordinated entry, and they would be either experiencing homelessness or at risk for the No Place Like Home units. And then the other units could be, they are not specifically designated for homelessness or at risk. They could be, or they could not be. They're just general, they're not restricted other than by income. The supportive services, really they come in two two forms. The one, the county will be providing case management for all the No Place Like Home units. And then we have a contract with an MOU currently, which will turn into a contract with a group out of Sacramento called Life Steps. And we have been working with Life Steps now on many of the projects that I just showcased for years. And that's what they do. They provide supportive services just at the private sector level. So they would provide case management to any of the residents that may need that, that are not the No Place Like Home units that the county wouldn't serve, as well as they'll provide an on-site resident service coordinator. And that resident service coordinator really is responsible to, keep a pulse on the community, work with local community organizations to bring services to the property that are relevant for the different residents that live there. So on-site resident service coordinator really works closely with the case managers and the local community to keep connected with, the population that lives there, what are the needs, and really kind of bridges the gap between what offers are out there in the community and what's needed on site. And that's a full-time position. They would be there 7 days a week, or sorry, 5 days a week, 40 hours a week. I have 8 hours a day, 5 days a week, or 40 hours. And then we also, our intention is to have a 24-hour desk service. So that really helps make a project successful. We've found in our experience that you really need to have somebody there 24 hours a day. That doesn't mean that it's a security guard, but it just means that there's somebody there that the community residents can go to, that, if there's something that goes on, they can help, de-escalate it or help coordinate or whatever might need to be done. So we do have our staffing plan would include somebody at the desk 24 hours a day, 7 days a week, 365 days a year. As mentioned, that Danco would be the property management company. So we do that on all of our projects. We develop, we build, and we property manage. So we intend to be the management company, and we would then contract out the care component to Life Steps out of Sacramento. We do have a number of these projects going. As I mentioned, I showed you a few. We have others. We are working in Sacramento. We are working in the Bay Area a lot, in Santa Rosa, Petaluma, bringing forth other projects as well. So we do have quite a bit of experience, and specifically with the No Place Like Home Fund. So with that, I don't know if there's more information wanted. We are processing our entitlement, which is not really an entitlement. The state has provided a pathway for these type of projects so that they can get built. And we're processing our application through the City of Sutter Creek using the state bill AB 2162, which is basically a streamlined process that makes the project by right. And that application's been submitted to the city, and essentially it just means that it's CEQA exempt. And with that, I'm here to answer any questions.
Board questions.
Chris, real quick, how long, this is Supervisor X, could you tell the members of the audience how long you've been in business and doing this? Yeah, we've been in business for 35 years, and we've been doing affordable housing for about 22 of that 35 years, and have brought forth about 1,700 units, and we have about 1,000 more that we're working on. So let's call us probably a medium-sized firm with regards to affordable housing in the state.
It looks like your project is CEQA exempt, is that correct?
Yeah, the state has a streamlined process. It's part of it was adopted about 5 years ago. It's called AB 2162. And it essentially, as long as you propose a project on property that's zoned multifamily, which this is, that you're by right, and the project is allowed to move forward through that state streamlined process. So yes, the project be CEQA exempt.
Wish the state would do that in some of our fuel reduction projects.
Yeah, they have a big emphasis on housing, and so given the, really, I think the current administration sees that housing is a crisis, and I wouldn't disagree, and that and this is just a way to make sure projects are able to move forward in a timely fashion.
You've got a good track record, Chris. What can you say about the history of your facilities as far as impacts on the community, a positive, negative?
Yeah, the impacts are, what I can say is that, as with any project, there, we've done multiple projects. There's been definitely some concerns as we've gone along. I think there's a lot of fears oftentimes in communities about a project like this. But what we're experiencing is, the residents that are going to move in here, they're already in your community. And I think people find, after our facilities are done, and notice that they're well staffed and they're high quality workmanship and construction, and they're designed well, that they become an asset to a community, that they become successful, and that the folks that you might be seeing around the community now, that maybe they're camping somewhere, or getting shelter under an existing commercial business or whatever, that they're able to get into a home, and it's a better situation for everyone, not just for the folks that are getting in the home, but the community at large. And so we've gotten a lot of positive feedback from our local communities that we built these in after the fact, when sometimes it had been controversial prior to. So I think that, for the most part, certainly there are challenges. I mean, as everybody knows, that some of the folks from the No Place Like Home program do have severe mental disabilities, but they still need a home, and we staff them with folks that are qualified to help with that, and their objectives are to keep them in housing, and the end result is a win-win for the resident and the community.
Any public comment from the audience at this time? Yes, sir. Come on up. You could state your name for the record, please. Good morning.
Good morning.
Good morning. Either one. You can take this one over here. You're a little bit taller.
My name is John Murphy. I'm president of the St. Vincent de Paul Society in Amador County. We do help the poor. Last year, we provided assistance to some 1,500 residents of Amador County, about $70,000 in assistance in terms of rent and other needs, utilities mainly. This project is the right project. It's at the right site, and it's at the right time. What do I mean by that? First, it's the right project. As you saw and heard today, 22 units are going to be for those people that have mental challenges, particularly those that are living under our bridges right now. And 24 units are going to be for our senior citizens, people that live on Sacramento Road in the mobile home park there, who are going to be eased out of those homes because of higher rent, those senior citizens that we have. Each day, we're trying to support those senior citizens by giving them the aid that they need. But this project is essential in this county. It's the right site. What do I mean by that? I'm an urban planner by profession. This meets all of the needs for a low-income housing unit, perfect transit location, right next to a drugstore almost. The site, all you have to do is walk across the street to get to the transit terminal. You can go to Sacramento if you have a major doctor problem, or to our local hospitals. And finally, it's the right time. What do I mean by that? Money is there right now. $2 billion the county has the state has put together for assistance for housing. No, we haven't had that opportunity to make ourselves available for this for a long time. Please, I urge you to continue moving this forward. Thank you.
Thank you.
Thanks, John.
Morning.
Good morning. My name is Ty
Morning.
Pulskamp. I am the outreach specialist for Operation CARE. And as you know, I've been involved in the homeless task force since its inception. So Operation CARE was formed in 1980 and has served an average of 300 people a year, men, women, and children experiencing domestic violence here in our county. As you can imagine, the looming weight of being without housing for yourself and your children often keeps victims entrenched in an abusive environment. Likewise, when a survivor is able to leave an abuser, along with the weight of physical and mental health recovery, housing is crucial. They are basically all of our clients who are leaving a domestic violence situation are considered homeless at that point. Though our agency hosts a small shelter stay for survivors, the duration of occupancy is limited in order to meet an average of 30 to 40 survivors moving through that shelter every year. So building additional low-income and supportive housing units in Amador County is crucial, not only to support those people who we think of as homeless, but also people who are surviving domestic violence here in Amador County. Thank you.
Thank you. Come on up, sir. Why don't you come on up and sit right up in front? You'll be next.
Go ahead, Trixie.
Morning.
Hello, I'm Trixie Smith, and I work for Cal Voices at Sierra Wind Wellness and Recovery Center as a peer support specialist, and I'm Amador County's patients' rights advocate. I'm also on the Amador County Homeless Task Force. I'm on the Community Outreach Subcommittee. I've been involved with that since day one. And I have also been involved with the No Place Like Home project and in support of it from the very beginning. I have a brief statement that I'd like to read. I did submit that for the board, but I'd like to read it for public comment, if I may.
Go ahead, ma'am.
Dear members of the Board of Supervisors, as a member of the Amador County Homeless Task Force Community Outreach and resident of the county for 12 years, I voice my overwhelming approval and appreciation of the No Place Like Home project. This is a time invested, very well planned project that will provide affordable homes for those who lack housing and face a multitude of complex medical, mental health, and or substance use issues that are co-occurring. As these are important ongoing issues that need to be addressed in our county, I see the No Place Like Home project to be a long-awaited resolution, as well as a blessing to not only the community at large, but to many needful individuals. Thank you.
Thank you.
Hi, Al Beer, Cedar Creek, and if I could, I'd like to start with a couple of questions. The grant award is in June. What if we don't get it?
Melissa, you're gonna have to come up to the.
In terms of, for county behavioral health, if we do not get awarded that funds, there's not much that we can do. I don't know if Chris has a response to that on his side, but behavioral health department doesn't have additional funds to do anything else if we don't get awarded those funds.
Why don't we see if Chris has any feedback on that?
Sorry, I was locked, being able to get off mute. Well, I will say that our preliminary indications are that we're going to get awarded because they did publish a list of applicants, and the area, or the bucket, I should say, in which we compete in was undersubscribed. So it looks to us, just our preliminary read is that they're going to fund all projects that applied in our area. However, if we're not successful with the No Place Like Home Fund, there are other ways to fund a project. Some of the slides that I went through and showed do not have No Place Like Home funds. They have other HCD funds or just tax credits. So there's more than one way to go about it. So as long as we've still had, support, we would continue to work to bring the project forward.
Thank you. And then a follow-up question for Chris. When you made the presentation to the Homeless Task Force on this project, I asked you a question that day, what the timetable might be if everything went smoothly. When might people take occupancy?
Yeah. So the awards, as stated, are in June, and if we were able to achieve an award in June, we could essentially put in a tax credit application, which would be the remaining funding needed, because this is only a portion of the total capital required. But we could put in an application for the other funding in July, and they would award those in September. We would then pull permits. We would need to pull building permits within 6 months of that award, which would be, call it March 2023. And then it'll take us about 12 months to do the construction. So then we would be into March, first quarter 2024, and then lease up. And generally speaking, lease up takes a day because the housing is so much needed. So that's not a long process. If we were to miss the July application date for whatever reason, if we couldn't pull that off, let's say HCD's awards were late or something like that, then we would be all the way into the first round 2023, which would delay that process I described by about 9 months.
Thank you. I'm here, Al Bierce again from Cedar Creek, to speak in support of this project as it is designed for Cedar Creek. I want to give a little background. I was born in Cedar Creek, raised in Jackson, moved to the Bay Area, came back and lived here for the last 20 years. When I was in the Bay Area, I was a police officer in Berkeley for 31 years and have interacted with the homeless in countless situations. It's probably given me an empathy that is pretty strong. Also, I've been attending the task force meetings for the last couple of years, and I'm a liaison with our church, the Creekside United Methodist Church in Cedar Creek, working with the homeless. As John said, this is the right project at the right place at the right time. And I'm not going to duplicate everything that he said. It's the right time because it's now as much as it is now in March of 2024. We've needed this for years. It's the right time. And it's the right place for a variety of reasons. It's about as well situated as it could be. It's close to the Interfaith Food Bank. It's close to Public Health and the Welfare Department. It's just up the road from ADCA. There's a lot of support agencies that are close by. I think that that's critical. It's the right place because it's not in a traditional neighborhood, but close enough that there's a community feel to it. And it's also not in the bowl of Cedar Creek. And I think that that's important as well, because this is something that has to work for everybody in the community. And I think that the community will be more receptive to it if it's not down in the bowl of the city. Regardless, I feel like it's the right project at the right time. And hope it has your support, and I hope it has the city of Cedar Creek's support.
Thank you.
Thank you.
Thank you.
Good morning.
Good morning. My name is Deborah Kempker, and I work at Sierra Wind as a peer support specialist. Other than that, I'm known from the Homeless Task Force Committee I reside in Sutter Creek. I've lived there for 3+ years. I've lived in this county for 20+ years. I've raised my kids here. And to go back on what Ty was saying, it's what made me have the courage to come up. 2 times in my life I have been homeless. Both of the times have been because the domestic violence was so bad. I'd rather live on the street if I had to. And currently, I live right about on Sutter Hill Road in Eureka. So I'm right around the corner from where you guys want to do this. And I have absolutely no problem. I think it's going to be such a benefit for this community. And currently, myself, I've been on disability before I started this job, so I've been taking a leap of faith that I can get off of disability after 15 years. But I pay about 75% of my income, my current income from Sierra Wind for rent. Besides my landlords increasing it to the maximum that they legally could, they decided to build a parking structure and are now charging us $60 if we want to park there. There's loopholes to these landlords raising their rents. And to me, it's just criminal to succeed off the misery of others. And I really hope that this goes through and it would bring hope to our community, and we need that. We need that really bad. Thank you.
Thank you. Thank you. Any other public comment from the audience? Mark?
Mark Oliveria, Jackson, very familiar with the homeless problem. Pat, as you know, I live on the north side of Jackson, so I see it every day since it started. Every day. So have my children. I just want to know, maybe Chris can answer this question. What are the parameters for getting someone into this facility? Are there going to be drug tests? How are you going to control the drugs there? When you say resident, what does that mean? Does that mean they've lived here for 6 months or 10 years? You know, I see a lot of these homeless people have not been here before, and they came here, and I don't know what happened. But those are some of the things that I want to know about. How I'm for this. Something needs to happen about the homeless problem, but let's do it the correct way and take care of the residents.
Thank you. Chris, can you address some of those comments?
It's also outlined in the presentation that Melissa was given too, that there would be screen applicants in partnership with the county, engage with residents to ensure compliance with lease terms, and there's going to be counseling, peer support activities. So,
Melissa, maybe you can talk about, this is not for those people that are presently homeless, right? They have to have transitioned out of homelessness already.
Right, or in the process of transitioning out. So for the No Place Like Home units, it's the coordinated entry system. So people have to apply and go through that process. They have to be engaged in services and willing to be participating in services and getting those supportive services. And then for the No Place Like Home units, then that would be, Danco would have that screening process, and that would be based on income because it's affordable housing. But for the No Place Like Home units, it's it would have to go through that coordinated entry system. So it's not just somebody walks off the street and says, I need a place to live to get there.
And is that completely subsidized housing for the No Place Like Home?
I think that there is initially, but then the whole point of this is for it to be permanent supportive housing, so that they will be paying, they may initially pay just a portion of that, and then after they get more on their feet, they would be paying more based on their income.
Yeah, I can add a little if you like.
Go ahead.
So all the units are rent restricted, and as Melissa spoke, No Place Like Home units got to go through coordinated entry. The remaining units, they just have to qualify income-wise, but we also check references, and we do a criminal background check. We do also have house rules, So in other words, we have just rules as any normal multifamily housing project would have. Noise at night, and disturbing neighbors, keeping your areas clean and neat, those type of things. But mostly what we've found is once somebody, because we're going to be oversubscribed. I mean, I was looking at the market study. It's, the need is 200 plus units. We're providing 46. So we're going to be oversubscribed. So mostly what we find is once people get into the housing, they don't want to screw that up. They don't want to be the one that gets evicted. So we have a suite of affordable units and we have market rate units, and we actually have more problems with our market rate units in terms of collecting rent and people's behavioral issues, because they're harder to keep full. But our affordable units, where there's such a backlog of people that need them, our experience is that they really tend to want to follow the rules because they want to keep their housing unit. So just wanted to add that. Thank you.
Mark, does that address your questions?
I don't think it did exactly, Mr. Chair. If I heard Mark right, Melissa, you've been coming to the homeless task force meeting, as have I, and the percentage of homegrown homeless versus the phantom white van that's shipping them in from San Joaquin, it goes from 30 to 80%. Will there be if I heard Marco right, are we going to try to take care of the homegrown homeless? Would they have a preference over someone who blew into town last week and heard about this program?
I think that the folks that are not from here and just blowing into town are not going to be engaged with us and not engaged in the coordinated entry. When we were developing our supportive service plan and going through this process, the way we kind of envision this is there's people that are already engaged in treatment and that are maybe couch surfing or struggling to have a permanent supportive home. So those are the folks that are already in the coordinated system waiting for places, but there's no places for them. So my guess is what's going to happen is these are already folks that are here. There are clients that we've been working with to help get them to the point where they can be successful in a place like this. So they're already in that coordinated entry system waiting for housing, and part of the issue is there's just not enough housing.
Okay, thank you.
Let's go to Zoom and take Ms. Ross first.
I had a question or two. Richard?
Go ahead, Brian.
Yeah, no, I have a similar concern as Mr. Oliveria and Supervisor Crew. It's one thing if we're housing people that are here. It's something else if we open it up and bring people in from outside and bring more. We really don't need that. And as far as the white van, yeah, I've been hearing that rumor too, and it seems like maybe possibly one of the homeless or wellness centers may have been bringing people in. That's something I've been hearing real recent, something I want to check on. But yeah, the white van's been a real question for a long time. Even when I talked to some of the homeless people, they said they'd seen it. So I think somebody's shipping them some in. Also had a question on the building type. It shows there's some pictures here, the buildings, but it's all building A. Maybe Chris could let us know what buildings B and C look like.
Well, they're all similar looking. I flashed that slide on there. Oh, it just shows building A. I see. Yeah, I don't have the elevations but they're similar. They're similar looking buildings. Like just
similar type architecture?
Yes.
Thank you.
All right, let's go to Susan Ross now.
Good morning. Can you hear me?
Yes.
Okay, awesome. So good morning, honorable supervisors and members of the community, and thank you for all the thoughtful time and energy you direct toward the benefit of all Amador County citizens. You're greatly appreciated. I'm Susan Ross, a Sutter Creek resident, here today to express my grateful and wholehearted support of the No Place Like Home project. Thank you to the Homelessness Task Force, ATCA, Supervisors, Axe and Crew, and all those who worked on this project. how truly blessed and fortunate we are to have the state funding to provide these affordable units for our mentally ill, housing insecure neighbors, as well as provide affordable housing for our hardworking, low-income neighbors. This is a dream come true. Danco chose an excellent property, close to transportation and services and zoned appropriately. Not only will safe and affordable housing be provided in an excellent location, but linked with Amador County behavioral health, there will be opportunity and support for residents' health and well-being. It is known that true progress towards wellness cannot be achieved until the basic needs of food, shelter, and safety are realized. Amador County citizens, especially those in Sutter Creek, are warm, compassionate, and inclusive. I am personally honored to have this wonderful project within our city limits. I hope it is just the beginning of a brighter future where there's affordable housing for all members of our community, and housing insecurity in Amador County is nothing but a bad memory. Thank you for your time.
Thank you. Can we go to Dr. Zeiderman now?
I just
Go ahead,
unmuted
Dr.
myself. I guess you can hear me?
Yes. Yes. Go ahead.
He muted him.
We can't hear you now. You muted yourself. Please unmute. There we go.
Okay.
Yes.
Thank you. So I've been to the majority of these homeless task force meetings over the last several years. And I've watched this proposed project come along. And I consider it to be an excellent plan. I'm particularly interested in the fact that 20 of these beds will be devoted for those with mental health problems. And I think they're an important segment of the community and their needs need to be addressed. And I think the location is very good. This has all been spoken to before. I do want to say just a couple of things about some caution I have and concern, mostly about the long term. Sometimes things sound just perfect up front and they don't, things unwind. And I think it's important that we see that over a period of 5 or 10 years, there is compliance with the intention, that there be some controls here. For example, we don't want a situation where there's a changing nature of who's there. Well, there aren't enough of these beds, so we'll give it to someone else. So I think that long-term compliance is important, and I don't know whether this has to be built into the structure or built into behavioral health or directly a long-term responsibility of the Board of Supervisors. But things tend to change over time. I think that the behavioral health role is key here. I think they do a great job. I hope that will continue. And I also suggest that we will coordinate with other organizations like Victory Village that have beds, and that we look at the overall number of beds available to those in need in the community. But basically, to summarize, I'm in support of this. I think it's a great project and a great place. I just hope that we can do it in a way that it fulfills our needs, which I know everyone wants. Thank you.
Thank you, Dr. Zeiderman. Is that Mary Postcamp? Go ahead, Mary. Have to unmute.
Okay, thank you. Good morning, supervisors and amazing staff for the supervisors. As a business owner in Jackson on Main Street, I have been significantly impacted by the homeless situation. As a landlord, a HUD landlord now, also impacted. I'm a resident of Sutter Creek. I live not even an eighth of a mile from the proposed building site. And I put most of these points in a letter to you all, and I know you received many letters from other residents. I would be very proud, as Susan stated, to be a resident and have this put in as a good first step. I followed Danco and No Place Like Home. I've been involved with the homeless task force for many years, and I urge you to consider this And let's take this first step. Thank you.
Thank you. Oh, there we go. Chris, you have more comments?
Well, I just wanted to address the compliance comment that came up in case it's not known. There will be regulatory agreements that are filed on the property and that really ensure that the property stays in its affordability status for a period of 55 years. And there are annual audits that are done by the state that come after, us as the developer, general partner, property owner, if we're not in compliance. So there's a whole compliance structure in place to take care of the concern that was brought up by one of the speakers. That it's important to understand that we have to follow these rules and regulations and provide the housing and we have to keep the maintenance up, we have to keep the staffing up, we have to do all the things that we promise, and there are people checking on us, not only at local level but also at the state level as well. Just wanted to add that.
Thank you. We did have letters of support, one from a Dr. Betts Arroyo Rivera and another one from an anonymous taxpayer. Any more comments from the public in the board chambers? And no more Zoom, right? Okay, so we're getting back to the board, and Mr. Eiley, basically, there's not a request for action here.
No, this is simply the update that the board had requested at the last meeting. So if there's any direction you'd like to give us to do anything differently, now would be the time to do that. Otherwise, we will continue down this path.
And the board committee on homelessness directors, acts and crew are meeting with representatives from Sutter Creek, is that correct?
Correct.
Yes. So any comments from you gentlemen on that?
We haven't met yet.
On that meeting, no, not yet.
In general?
Well, I've been involved in the process for some time. I think, during the course of the homeless task force meetings, which is really an advisory committee, it's not a standing committee by this board. So we looked at a lot of different scenarios or heard about a lot of different scenarios. And the one thing, first of all, there's not enough of affordable housing or apartments in this community. Also, on a separate note, going through an economic development study, that also came through very clearly. That's necessary for our economic vitality. But the fact that there's just not enough affordable housing, this is a project that provides that. That is something that's palatable. It's better than, a tiny house village or a tent city type scenario that some of the larger, more urban areas have implemented. And because it is permanent and it looks nice. And in addition to that, transitional housing or sheltering is another component. And we've worked toward making that happen as well, using the funding that's coming from the state, not only for building housing like this, affordable housing, because we're in a housing crisis in this state. That is the governor's plan, that is the state's plan to build more housing units. It looks like we just went through this housing update recently. We need about 700 more units of housing over the next 10 years. And, this is just a drop in the bucket in many, many respects. So these are, I think, scenarios or strategies that are acceptable to the public. As opposed to, say, the low barrier shelter concept, which was not strongly embraced by all. And there are rules, and I think that this is the best path forward.
I thought John Murphy at the start probably said it the best. It's the right project at the right place and at the right time. We've gone from stackable containers out in the brush to car parks to every other conceivable thing, and Melissa's been at all these meetings. This is a project that checks all the boxes. So, yeah, I think our support is key. I think we have it, and let's keep moving. Because realistically, time flies. March of 2024 is not that far away.
Everything's a piece of the puzzle. And I think every municipality has to recognize that. Ione has a project coming. It's, I don't think it's been pushed yet, but a piece of property right next to the station, Fire Station 2 on Preston Avenue, that's zoned for dense housing, has been purchased by CRP Affordable Housing, supposed to be a very good company who's experienced in providing affordable housing, and according to the person that sold the property to them, it's they're planning on up to and exceeding 250 units of affordable housing. So every community is going to play a part in solving this, including the county. When the Wicklow property is master planned, I expect there to be a portion of that plan for this type of zoning. Any other board comments?
Yeah, I have a couple. As far as this type of project, I'd say it's probably about as good a location as you can find in the county. I do find it kind of, we talk about affordable housing, but then I look at our next agenda item, and it's SB 1383 as far as deals with composting our garbage, and then it's got in there compliance with Cal Green recycling requirements and compliance with model water efficient landscaping ordinance requirements. Well, I think what's happened, this state has made affordable housing a myth. You can't build it anymore as far as in the private sector because they made building homes very expensive. But that's something I don't think we're going to change. It's just one of my pet peeves.
That it?
That's it.
Okay. All right. There's no further comments. Thank you, Melissa. Thank you, Chris.
Yeah, thank you all for your time, and hopefully we'll have positive response and get that award letter, and if we do, I'll let you know, and then we'll go from there.
Fingers crossed until June.
Yeah. All right. Thank you.
Thank you. At this time, the board's going to take a quick break. We will resume at 11:15. Call the Board of Supervisors meeting back to order, and we're going to go to our 10:30 notice public hearing. Now, this should be a quick item. Surveying Department, public hearing for a public utility easement abandonment as shown in Exhibit B here too. Said easement is being vacated as part of the request for APAL Humane Society and Tri-County Wildlife Care merger. The property involved is located at Trade Center Drive, parcels 8 and 9. And with that, Mr. Pitto, and also it says merging the lots will allow for installation of solar power, parking, and fencing.
That's correct, sir.
So we'll open the public hearing at this time and take your comments.
Okay.
Go ahead.
Thank you. This is merging these two parcels will raise the gross area to 1.79 acres, which gives APAL and the Care Center room to do some improvements as discussed and described. we see nothing controversial about it. It's very straightforward. And what happens is we have down the two lots are similar in size, trapezoidal, and as you see on your picture, it bisects the parcels that we want to create as one. So we want to get rid of that easement, and we don't see the necessity to create another one.
Okay.
Thank you.
Any board comments? Any public comment on this item?
We open the public hearing, or?
Public hearing's been opened and it's ready to be closed.
All right.
All I need is a motion.
I'll move to close the public hearing.
Second.
Moved and seconded to close the public hearing. Any further discussion? All those in favor? Aye. All opposed? Motion carries.
Thank you.
Thank you. So now we need to, approve the resolution of approval.
So moved.
I'll second again.
Moved and seconded to approve the resolution. Any further discussion? Any public comment? All those in favor?
Aye.
Aye. All opposed? Motion carries.
There are two resolutions.
Thank you again.
Fiddle.
That motion there were two resolutions.
Is that, what was intended of the motion maker?
Yes,
Yes.
all resolutions.
All right, very good. All right, we'll go back to our regular agenda and go to item 4G, an ordinance creating chapter 7.21 of the Amador County Municipal Code relating to the requirements for the reduction of organic waste disposal and to enact regulations in compliance with Senate Bill SB 1383 for the implementation of food and organics recycling and related solid waste and recycling processing and reporting. The suggested action is to waive the reading of the ordinance 22-XX. Mr. Gardner.
You get me and you get the other Pitto, Mary Pitto, helping me today. Good morning still.
Morning.
Nice to be here. It's a beautiful day out. I'm sorry I don't bring wonderful programs like everybody else has brought this morning. But we do have some business here for the Board of Supervisors. I have worked diligently with our consultant, Mary Pitto, and our county counsel, Mr. Gillot, in bringing forth this 17 or 18 page code change that we're going to attempt to adopt here. As Brian brought up, it doesn't make things easier for residents of the county. It does make things a little bit more difficult, and it does add some additional work onto not just the solid waste department, but also building, planning, and environmental health here at the county. We were able to adopt the waiver for the organics requirements here for the county. We have all of the cities have adopted waivers on board, and I believe everyone has been accepted at this point. We do have 2 or 3 of the cities that have adopted their ordinances for this requirement, and the ones that haven't adopted them, I believe, are Amador City, which is in the process of doing so. Obviously, you have to have 2 meetings. They only meet once a month, and I don't believe Sutter Creek has adopted theirs. I know Jackson has adopted theirs. I know Ione has adopted theirs, and I know Plymouth has adopted theirs. So I think all 3 of those have gone through both of their meeting requirements, so they're probably still in their 30-day windows in terms of the ordinances being adopted. This is our first reading of it. We have, besides the organic recycling requirements that were part of SB 1383, there are some other requirements. Mostly they are reporting and essentially recovery and reporting requirements. And they have to deal with the State Model Water Efficient Landscape Ordinance, MOELO, the Cal Green C&D debris recovery, which is construction and demolition debris recovery, and there is the edible food recovery reporting requirements. So they essentially get integrated into a couple different, 2 or 3 different areas in the code section. We have put them all under what we're calling the new 17 or 7.21 organic waste disposal reduction area of the solid waste reporting requirements, because that was the easiest for us to do at this time. Cal Recycle gave us a 36-page ordinance to sort of take our pick from in terms of what was applicable to our county. Being a rural county, we took out as much as we possibly could. There may be some stuff in here that we may find additionally we might be able to get rid of in the future, but at this point we've gotten it down to the most reasonable and hopefully the most easiest for us to implement at this time, and we'll see how it goes.
As I understand it, ACES is going to have to either have one of their employees or employ someone new to go out and look in garbage cans and see if people are recycling their organic waste properly.
We're still working through that with Mary has gotten on board, and I may have her step in and discuss what she's discussed with Cal Recycle. But we're still waiting on, I believe, some information back from their legal counsel with respect to what the expectations are in terms of sampling. Mary, if you're there, could you turn her on? Mary, will you?
One more question before you do it,
Okay.
because Mary can address this too, but what happens, I mean, we live in a rural environment, and a lot of people already take their organic waste and put it in the garden and use it for their gardening purposes. So what happens if there's nothing in there? I guess we all have to have an organic waste container.
Actually, no. Let me address that first, Mary. Actually, since we were able to get the waiver on the organic waste.
5 years, though, right?
Yeah, for 5 years till January 1st, 2027. Ultimately, if that doesn't get renewed or Cal Recycle doesn't make changes over the next 5 years, that could potentially come into play. There is the low population waiver, which we haven't applied yet. There's the elevation waiver, which we haven't applied yet. So there are some other means and ways to get out of that in the future.
What's the elevation of the elevation waiver?
4,500 feet. And you know, that's been debatable too. And that elevation waiver is predominantly to deal with bears and things like that. We've brought up now at the point that bears are down in Rancho Murrieta at this point. So probably driven there by the fires, but nevertheless, they're still around and they're at lower elevations. But in terms of just recycling the organic waste, if people want to, they can put it in their green waste containers at this point. If they take that, if they want to compost it themselves, they don't have an obligation to do that. They can self-compost. I come from an urban area where we're being mandated this law. So what they're doing, I mean, I happen to live in a homeowners association, a condominium development, and we don't have green waste. We have landscaping services. So the city's response to that for me is I have to get a new can, and I'm single and I don't exactly generate a lot of organic waste. And predominantly, I would probably start throwing it down my disposal if possible. But they're going to make me take a can anyway, you know, which has all its own components and things that aren't favorable to me, but they're going to make me pay for it too.
I just don't want people to be penalized in the, now or in the future for composting and not having anything in their containers. I want the ability to reject that if we.
Right, and I don't think, and I think green waste containers in this county are free at this point, and hopefully they remain that way.
They're never free. They cost something to
Yeah.
to the agency that supplies them, and that's get passed on to the ratepayers.
Right, there's free is a misnomer, but, there's no additional cost on top of for a regular can, which in my case, in an urban area, I do pay an additional rate for a green waste can too. Yeah, they would be able to put, if they had a green waste can, they would be able to put that organic waste in the green waste container.
By the way, there was a bear going up Fairway Drive in Ione early one morning too, so. Not with golf clubs either.
Right, but now, Mary, will you address, the sampling and ACE's responsibility with respect to that and where we stand on that?
Sure. At this point, what you were referring to, Supervisor, is that they won't be sampling cans at this point. That would occur when the actual collection of the organic waste is required. But they are going to have some sampling requirements above and beyond what they do right now at this point. We're still working through what would be required of them through CalRecycle, and we've been dealing with CalRecycle's legal group, trying to make it very clear what will be required of the facilities in the way of sampling. We are and RCRC are of the opinion that we should be exempt from the sampling requirements as well. We did get one decision at this point that they will not have to sample the gray containers, but they may have to still sample their source separated, like the cardboard, but we're still working through that. And also, I think you're going to find over the next couple of years that as everybody works through these regulations, I think there will be new legislation to clean up some of the requirements. RCRC has already committed to, they are going to be working on new legislation. And I know that as the implementation has been progressing at this point, many counties are looking at new legislation to reduce the requirements.
Thank you, Mary. Any other board comments, Supervisor Neto?
Sure, I've got one. I think the state keeps growing their programs. I think we have to come up with a program for affordable garbage housing. Garbage is going to be, we're all going to be broke. You know, Greg, and it's something from the state, so we can't say no, can we?
Well, so a lot of these things are already state law. So the model water efficient landscape ordinance was passed, I think, became state law in 2015. So this is really has more to do with requiring reporting related to these things. The purchasing of recycled products is already state law. Basically, if you can buy it for the same or lesser, you have to buy it. That's already state law. We already have a policy. There's just a reporting component that's part of this legislation.
Organics, what I'm talking.
The organics is, yeah. So when it comes for us, we will have to implement it. But right now we have the waiver, so we have to pass this ordinance that's required. A lot of the meat, a lot of related to the recycling is not in it. But it was still required. It's still something we had to pass by a certain date, even though we have the waiver. And then if that waiver goes away, then we'll have to put all that stuff in, whatever it is at the time.
What else is interesting too, it looks like non-local entities are not subject to the county's enforcement authority of the legislation. It looks like the state's not subject to the authority, nor is the federal government, nor is prisons. So, interesting.
Supervisor Brown.
Yeah, the penalties, as I was looking at part of the ordinance, seemed a little, you know, $50 to $100, $100 to $200, $250 to $500. Why do we need such high penalties just for?
So those penalties are right in the state law. They're required. It's one of the pieces that the state was specifically wanted to see in our ordinance. It's not something we've implemented. The penalties are exactly as they read in the state code that we're supposed to implement, fortunately.
I like one portion of this where the businesses, restaurants are going to be working with the food bank. I wish it was voluntary and not mandatory, because shouldn't be a function of government to force that upon the businesses. It should be voluntary efforts, but that's not the way the state legislators thought it should happen.
So I just sent out letters on last Thursday to 13 Tier 1 generators. Essentially, it's the grocery stores in the county and in the incorporated cities. So those did go out. I did call and talk to almost all of the store directors, managers at the stores, and they were aware of this. And we've been trying to work with Beth to get her to get the contracts and that kind of thing out, but she's a little overwhelmed, so we sort of stepped in and helped her with that. And I sent a letter out, and I sent the requirements out, and then I called up and I spoke with the store managers and let them know that if they had any questions, any issues in implementing or getting the contracts done, or any questions regarding the system as a whole, as we move forward, that they can call me. Mary is available to help with that, and we're also available to help with Beth. One of the big pushes in this legislation is the food recovery. That's one of the bigger emphases in all this legislation, and it's one directed at getting the organics out of the waste stream, but two, it's also directed at getting that food that's recoverable to the people that need it as well. So we have also applied for that grant, and hopefully if once we get this done and once Sutter Creek gets their ordinance passed as well, in beginning September 1st, we will begin. Some of that money will be for administrative purposes, but a big chunk of it will be to help the food bank, Interfaith Food Bank, in terms of we talked to Beth, and if they're looking for a new storage facility, which may include some refrigerated storage or freezer storage as well. So we're hopefully looking to help her either maybe get a refrigeration unit or some storage shelving or that kind of thing. If that.
You're taking Beth's thunder away. I'd like to go to Beth right now. She got her hand up.
Uh-oh.
So,
Hi,
go ahead,
Richard,
Beth.
thank you. I just wanted to say that we have had, for the 5 years that I've been here, great success working with the grocery stores, and I don't see anything changing there. So I think that they're on board really well. And I just wanted to say to Jeff, we really appreciate this partnership. I think it's going to work out well for all of us.
All right. Thank you, Beth. I'd like to try and wrap this up. So any other board questions? Any public comment in the audience or Zoom?
Mr. Chair, I do have a question. Just real quick. When we implement this, are we going to ship the organic waste collect it and ship it out of the county to someplace, or are we going to have our own facility here?
Well, at this point, I'm not there is a requirement for commercial institutions to have some type of organic waste recycling, and that is not negotiable. And I'm not sure what ACES is doing with that. I know there's a digester that was built by an Italian firm that opened up in Yolo County last year. Okay. And I know ACES has worked with them in terms of being able to take stuff to that facility. So that's really a question for ACES at this point. I'm not sure exactly what their constituents are doing at this.
Kind of a long drive for.
It is, and Kirkwood, who's part of the Vail Corporation, had come to them and said that they wanted to proactively start doing the organic recycling. So that was and it was actually our former LEA that told me about the place in Yola County and put me in contact with someone over there. And so I gave that information to ACES, and they're working that out. So,
Okay.
but other than that, yeah, one of the big issues about all the organic recycling is how are we going to do it? And places like Waste Management, Waste Connections, these multi-billion-dollar corporations are building huge digesters down in Orange County and in populated areas to deal with the volumes that they're going to have to do. But at this point, it's something that Cal Recycle has admitted they don't really have a projection on when they're going to be able to have all that production capacity online, or who's going to be providing that production capacity. But they just anticipate it's going to happen.
Okay, so it's a work in progress.
It's a work in progress.
All right.
You know, is this something that possibly you think that Vicini might want to build with their green waste facility, or maybe might have zoning permitting problems?
Yeah, organic waste and green waste are really two different beasts.
Yeah, they are.
And it's not something he wants really mixed in with green waste. He's not prepared to handle it here, so.
I doubt if we have the capacity to generate enough revenue to pay for the machinery.
That's the whole issue with the rural counties. I mean, we're 0.8% of all the garbage that's generated in the state. And our big push is that we don't generate enough garbage in general, let alone organic waste, to have that big of an impact on any of it in terms of what it's going to cost the rural consumer to deal with it. So
I'd like to really, Mary Piddle, we have for some technical comments before we go back to Supervisor Onetto and then the public. Mary?
I just wanted to point out that a lot of the requirements in SB 1383 that are applicable to those counties that have the exemption
Can't hear you.
They're already in effect. Can you hear me now?
Yes.
Okay. A lot of the requirements such as the Green Building Code, that is correct.
Mary, we're losing you again.
Uh-oh.
That Calaveras connection, I guess.
Okay.
Go ahead, try one more time.
I'll try again. I just wanted to.
Nope.
Yeah.
We'll, maybe we can pick you up in a little bit. Supervisor Onetto?
Oh, lost my train of thought, sorry.
Okay, Jamie, comments?
Hi, Jamie Lebanco, Fiddletown. I just had a couple questions for clarification. I actually sat through a presentation that Paul Molinelli Jr. did recently, and he spoke about this. And I was curious because I thought it was like the grocery stores, but businesses that created more than 2 yards or 1 yard of waste. And I didn't hear that today, if this is something that's being imposed on households as well, or if the waiver is just for households and it's just 2 yards and above, was, I guess, my first question. And then my second question was what the low population waiver was, because you mentioned the elevation waiver and a low population waiver, and I was curious what the low population waiver was.
Why don't you move to that mic and Jeff can answer what he thought you asked, and if you have any more questions.
So that's correct, 2 yards and above on commercial. And the low population is 70,000 or below.
But
the exemption we have for residential right now?
So we have just what's called a rural exemption right now, because that was available. But ultimately, we can apply for the low population waiver because we qualify for that as well.
And hopefully it will be granted.
Correct.
But the waiver is both commercial and residential right now.
Well, no, actually, but the commercial, if you produce less than two cubic yards I believe it's in a month, then you are not susceptible to the organics requirement.
Okay. All right, Mary, you want to try one more time?
If I could, how is Can you hear me?
Nope, not working.
Oh, no.
You're gonna have to come here in person next time.
I will do that.
All right, thank you, Mary. Any other comments?
Yeah, I know where it was, Richard. You know, I said, one thing too, in this county, a lot of people feed, their organics, their dogs, chickens, goats, pigs, I mean, yeah, so I don't see where it's a huge problem up here, so.
Yeah, but my dog won't eat lettuce or carrots. All right, we have some action to take here. So if I can get a motion from a board member? There is no, ifs, ands, or buts, it looks like.
I'll make a motion then to waive the first reading of the ordinance and put on the calendar this item for adoption on the April 12th, 2022 consent agenda.
Second.
Moved and seconded, that was by Supervisor Crew, the second, so to, waive the reading of the ordinance and schedule for adoption on April 12th. Yeah, I'd like to take action against this, but it looks like it could be relatively harmless with the exemptions, although the rate increases will keep going up at ACES because, they're being forced to have, new containers and an inspection person down the road to potentially look in private, residences' garbage cans, right, or the organic waste?
That's possible, but that would be again after 2027. But there's potentially one of the sampling issues is going to, if they can figure out where contamination is coming from. Specifically, what they're going to be required to do would be to take out of each quarter, they would do 10 days of sampling, at least 200 pounds of trash in each sample. And I believe one of the state's requirements in that is to try and determine through that load checking where that contamination is coming from, if they can figure that out, and then go to the source of the contaminant and educate the people about that. And if it continues to occur, then potentially get into the fine realm if that were to happen.
The good thing is they're not allowed to go onto your personal property, it sounds like. So.
Right.
Okay. All right. With that, we have the motion on the floor. Any further discussion? All those in favor?
Aye.
I'm gonna abstain. I don't want to join George Orwell's 1984.
Oh, you're gonna make us do it though. Okay.
It's just, all right, I'll vote for it. That'll make you happy. Put me down as
Along
aye.
for the ride, whether way you vote.
Well,
It's
we're all having to swallow a pill we don't necessarily like, so thank you. All right, motion carries 5-0. Thank you, Jeff.
Sometimes, Richard, it's not bad. It's just trying to, if we all pass everything 5-0, it looks like we all love it. That's where I'm coming from.
Well, then I'll back up and I'll vote no, and you can vote yes.
I'm fine with that. I'm fine with that, really.
All right. Item 4H, update on the Jackson Library project and reopening timeline. And good morning, Laura. How are you today?
Good morning.
Morning.
Laura Einstetter, County Librarian. I'm just going to make it very brief. The renovation is coming to an end, and once we're cleared to go back into the building, that is the library staff, then we'll transition from our temporary location to the library, and we'll need some time to get the staff work area set up. And then once we do that, what we're going to do while we're getting the library back online, so to speak, we will offer the picking up and dropping off outside while we work to put everything back in the library. That includes the furniture, the books back on the shelves, computers back up and running properly, desks set up, so forth. I anticipate that it'll take several weeks to get that all done. And so I'm hoping that sometime early part of May that we can reopen. And then we will, I don't have a firm date at this time, but we will look to have a grand reopening and tour the new space. It really looks far better than what we had previously. I think people will be very happy with the outcome.
What's the completion date for the construction?
that would be, Mark
Okay.
might be able to speak more to that, probably within the next week or so, I would say.
Mark Oliveria. The contractor has about 2 more weeks on the construction schedule, then we'll do the punch list, and, so we're looking at about 4 weeks until until the contractor's out of there. And then we come in there and start putting our equipment in, the IT equipment, the desks, and stuff like that.
So you might be lucky to get open maybe the second week of May, something like that.
It's gonna take longer than that. We have quite a lot of books that need to be sorted and put back on the shelves. We're talking, a lot of boxes of books, so.
Maybe mid-May, hopefully.
Yeah, I don't want to give a firm date because I really don't know. It'll depend on how everything goes.
Okay.
Did we release staff to half of the library, or we didn't do that? That's for Mark.
What was your question?
I thought we allowed, the staff back into half of the library to start restacking books.
I got my staff in there.
Just
right
your
now.
staff?
Yeah, and, we will.
Okay.
We will.
And just so people know, the library will be fully ADA accessible now, and, so that were some of the main improvements, correct?
That's the goal.
Yeah. So, any other questions? But the parking issue has been resolved with City of Jackson, so we have the paving issue, I guess, right?
It was my understanding that the city was gonna wait to do any of that until Caltrans was done doing their, drainage work, which is gonna come straight through the parking lot, into the creek.
That Supervisor Crew was tasked with getting that
Right,
done.
well, number one, that the city is not sure exactly where the boundary lines are, where Dieter Park ends. Marco's laughing because, so we're still at that stage, last that I heard.
There are some conflicting maps.
Caltrans easement, is it
Yeah.
15 feet or 25 feet? That was the question, so.
There's some conflicting, maps out there that the city and Caltrans and the landowners, besides us, ours is pretty clear, of where all the property lines are and where they're gonna come through with that drainage from that impound dam.
Which leads to who's gonna pay what fraction of getting it repaved, so. That's still a work in progress.
All right.
But the drainage issue is supposed to be this summer?
I just heard, I was talking to their public works person, and he was telling me that, there was no reason to start paving until Caltrans came through and finished theirs before,
That's what
putting in new
Juan told
paving.
me.
Yeah.
All right, thank you. Laura, anything else?
No, that's it.
All right, thank you.
Thank you.
We'll be patient a little bit longer. Next, we will go to item 4I, American Legion Ambulance Post 108 update from Ms. Michelle Tyre, ALA Vice President, regarding a request to Mountain Valley Emergency Services to secure a basic life support ambulance in Amador County.
Hello, everybody. Michelle Tyre with American Legion Ambulance. This strictly is just an update for the board. American Legion Ambulance is contracted with Mountain Valley EMSA. They're our regulatory agency. They're the ones that kind of say what types of services that need to be provided within the county and so forth. One of the things in that contract, it did say that at any point we could approach them and ask for a permission to go from the current services that we provide to something different. So currently we have 5 24-hour-a-day, year-round ALS or advanced life support ambulances. There is one up in Pioneer, one in Plymouth, one in the Sutter Hill area, and 2 down in Ione. Those ambulances are staffed with a paramedic and an EMT on each one of the ambulances. Our proposal and what we've asked for and have been giving approval from Mountain Valley just recently was to make one of those ALS ambulances in Ione a basic life support ambulance. So instead of being staffed with a paramedic and an EMT, it would be staffed with 2 EMTs. Now, this BLS unit would now be used for 911 calls that have been deemed as a lower acuity by the medical director from the Mountain Valley region. These type of calls would be non-traumatic back pain, a fall down, possibly broke my arm, no other injuries, somebody who might have a toothache, those type of 911 calls. So some basic services. The other thing that this BLS unit will be used for are for interfacility transfers from Sutter Amador Hospital to another hospital that they've already been evaluated and cleared by the emergency room physician. And that emergency room physician now says, this patient needs to be transferred for a service, but they're okay to go with this level of care as far as an EMT. The third big thing that we're looking at is Mule Creek State Prison. A lot of the calls that come out of that facility are also lower acuity calls. We get a lot of people that we transport out of there that might need to go for an x-ray, or that need to go because they have an abnormal lab pattern and they need to get further treatment and evaluation at the hospital. So we have a lot of calls that come out of that facility. And then the next thing is mental health transfers. We provide all the mental health transfers out of Sutter Amador once they've gone there and they've been medically cleared and they find a mental health facility for these patients to get further treatment. We're the ones that are transporting them out of the county to those mental health facilities. As we all know, mental health is a big deal, so the services and the locations are very limited. For us, that means that we could potentially be transporting one of these patients to Napa, Santa Rosa, Yuba City. Currently, being all ALS units, we are now taking that paramedic on that unit out of the county 5, 7, 8 hours with these mental health transfers. That doesn't benefit anyone, not our community, not us as a company. So we had to start looking at some other avenues and ways to how are we going to be efficient, not only with the resource that we provide our community, but the revenue that our company gets, the level of care that our citizens deserve. So we had to start focusing on how we can keep our paramedics in our community. And this BLS unit was something that has been used throughout the state of California and nationwide for many years. And finally, Mountain Valley has approved it to be used in Stanislaus County. So they had a little bit of a background on, oh, this is going to, potentially could work. And so we approached them back in December and said, can we do this within our county? So we have gone through this gamut of hoops that they've asked us to do. One of those is going out and talking with all of our stakeholders to find out if there is a concern, questions, all of those things. So we have met with Mule Creek State Prison medical staff, their chief surgeon and their chief physician and their chief of nursing. We've met with them. We've met with all our fire departments within the community. We've met a couple extra times with CAL FIRE Buena Vista because they do have paramedics on their engines. Currently, they're only department within our county that do. So there were some issues that we needed to work out with them in particular. We met with the Sutter Amador Hospital staff, and of course, with our dispatch staff. Dispatch will play a key part into this because, as I alluded to earlier, Dr. Can from Mountain Valley has approved which type of dispatches we would dispatch a BLS unit to. So we need our dispatchers at our dispatch center to understand what those directives are and how to implement it. And then, of course, be able to answer any questions that they may have. Because most of our dispatchers, while they are trained and they're competent, and we have some amazing dispatchers, a lot of them are on the other side and physically out in the services. So they're just getting a picture by what people are telling them. So there was some, hesitation and some concern with that. But we've been able to prove that this system works across the state. So that's why we've approached it. So the reason why we really wanted to do this was, one, as everybody knows, there's a healthcare shortage. So EMTs, paramedics, we are not immune to the healthcare shortage that you hear with doctors and nurses and everybody else. So we had to start looking at some alternatives that we could still provide some very valuable service to our community without without using a paramedic, if you will, on every single call. And when we started looking, the amount of calls that are BLS in nature really is going to be way more than what just one unit of BLS unit here in our community is. So we had to do our system status. Like I told you earlier, we want to keep our medics in the county instead of sending them out on these transfers. Obviously, there's a cost if you have a medic wage versus an EMT wage. You know, that is a little bit of a difference. And then revenue. It doesn't matter as far as an ambulance goes. If we have a paramedic and an EMT, 2 paramedics, a doctor and an EMT, or whatever the case may be, whatever the level of care that that patient is receiving is the level of care that we get reimbursed for. So every time we send out a medic, we are getting reimbursed for a BLS rate if that truly was a BLS call, okay? So as far as watching how this program is implemented, when it's implemented, our target is April 1st. We pretty much have cleared all of the ways to start on April 1st. We are required by Mountain Valley EMSA to do a daily reporting. So any BLS call that our unit goes on today will be sent in a report tomorrow morning at 7 a.m. to Mountain Valley EMSA for them to review. We are also required to review every single call in-house. We have also told our stakeholders and have scheduled really meetings already for within the first 4 to 7 days after the program's implemented, and have promised them that we will continue to meet with them on a regular basis so that we can keep evaluating this program and make sure that it's beneficial for our community, and then that we are not letting our citizens down and not providing them a service that they need. So our purpose today was just to come here and let all of you know that this is the direction that we are heading, to allow you to ask any questions that you might have, and see if we can to address any concerns. We did also meet with Dr. Kerr. I failed to mention that, but we did meet with Dr. Kerr too, and talk to her quite a bit regarding, you know, healthcare questions that she had for our county.
I met with Ms. Tyre and discussed this. I had one other question you might want to address right now. What happens if an individual being transported in a BLS ambulance has an event that takes them to the need for ALS?
ALS, yeah. So the dispatching, like I said, it really lays a lot on them in the beginning. So, and the dispatcher only can dispatch a unit as well as the caller is willing to give them the information. So if a BLS unit gets to a scene and they realize this is above us, we need a medic on scene, they can call dispatch and have them dispatch an ALS unit physically to meet them on scene. If they need to start transporting, we can meet in the middle and rendezvous, and the medic literally will just jump onto that ambulance. There will be no moving of the patient. Medic will just jump on. Or that BLS unit, if they are close enough to a hospital and it is severe enough, they can go code 3 to the hospital. We are fortunate here in our county, our operations managers are also paramedics, and they are on vehicles that are fully equipped with all ALS gear. And so they are out roaming around. So they essentially could meet up with that ambulance too and jump on their ambulance. And then we have talked with Buena Vista, the CAL FIRE group, that do have paramedics, and we have a verbal agreement with them. If we are down in the Jackson Valley area, we can actually have one of their paramedics jump on our BLS unit with us and go. Those medics are accredited to provide ALS services within our county.
I'd like to go to our Mountain Valley Emergency Services rep first. President Brown.
You know, we voted on this and approved it through our Mountain Valley. One of the things that a lot of people, you know, as we've talked about shortages, there's been an incredible amount of paramedics as shortages. The Stanislaus County, which also has AMR involved, has had numerous complaints because they haven't been able to keep up their transportation. And so other agencies are having to backfill them, and well, that's also killing their numbers. So everybody in the Stanislaus area is hurting. We've been very lucky that ALA has been able to keep all their numbers up very expertly, and this idea is dealing with, as a business aspect, trying to, as we're trying to help, with everything, but we still have shortages, and so it's a hard thing to do.
Any other board comments?
Sure. What's a paramedic paid, like a yearly basis at ALA or American Legion?
Alan, you got to come up. Sorry.
Good morning. Alan McNanny, President, American Legion Ambulance. So our paramedics, starting base salary, that's if they work 0 overtime, work their 2 days on, 4 days off. Base salary is about $72,000, and then top step, they're making about $92,000.
Does that include benefits too, or?
Benefits would be on top of that. So we pay 100% for their health care. We cover 75% dependent care on their medical, dental, vision, and life insurance. And our retirement 401k, we start out at a 6.5% match, and it's a tiered vested years of service, and it'll go up to an 8.5% match.
So roughly a top step paramedic at full load, what do you think that cost would be roughly?
I think last year I had 6 paramedics that made over $100,000. Okay. Total cost per medic, somewhere around the ballpark, $150,000 to $160,000 a year.
What's your highest paid, administrative staff? Would you say, what's that salary, like full load?
Operations are right around $100,000 a year.
That's your highest paid administrative staff?
Well, other than the vice president and myself, at about $120,000, $150,000.
That's the full cost of benefits and everything?
No, that's just salary and then benefits on top of that. Same benefits as the employees have.
So then you'd be talking like maybe $130,000, $180,000 total salary?
Yeah, probably.
Okay.
Yep.
Thank you.
You're welcome.
Other questions?
Michelle, I have a question. So, I guess you indicated that there already are 2 ALS ambulances in Ione, so you want to convert one of those to a BLS. So there still would be ALS capacity available.
Correct.
And what is the likelihood, or do we have a way of knowing, would 2 ALS calls occur simultaneously? I mean, is that high probability?
It does happen. Yes, it does happen. But more than likely, if you really start looking at calls and you start pulling out service calls, approximately about 17% of the time is the only amount of time that a paramedic immediate intervention is going to make a difference between somebody's life and death. So it is very small. A lot of times companies, you provide paramedics just for a state of readiness. Their true skills are not used as much as a lot of us think. Their true skills is genuinely only used about 17% of the time.
Okay. All right.
But yes, we'll keep one down there.
Thanks.
Michelle, you mentioned it looks like the heavy load is going to be on dispatch.
It is.
For the delineation. Have you got a training program or
Yeah, so
set up?
So as I had mentioned, Dr. Can actually goes through, when you use the dispatch center, they have a set of cards. They're a medical dispatch priority card, and it's a system that the dispatchers, as you call in, they start asking questions based off of this card. And how the response to those questions filters down basically tells them we're going to dispatch an ALS unit or a BLS unit. Dr. Can has approved exactly what types of signs or symptoms or potential problems that you can have an ALS or a BLS unit. So when we met with dispatch a few weeks ago, we gave them the list of all of those card sets and the determinants. That has been given to the dispatchers. They have gone through it, looked through it, figured out, you know, how they're going to indicate which card set goes to an A-list unit or a B-list unit. And I actually have a meeting with them tomorrow to kind of finalize a couple questions that they have, so that they are all completely on board. And as I had mentioned earlier, we will be meeting with dispatch again a few days after the program is implemented, so that we can make sure that all our dispatchers have very clear direction on what they're to be doing.
You probably send a lot of units out of the prison, I imagine,
Mm-hmm.
a lot of trips.
Yes, yes. At the height of it, before COVID, we were going out there approximately 100, on average, 100 times a month. And I believe now we're down to about 60 times a month.
Okay, any other board questions? Any public comments? Anybody on Zoom? No? Michelle, thank you, and Alan, thank you
Thank
for the
you.
presentation. Now you can go to lunch. Mr. Eiley, would you care if we took our transportation issue first?
I would somehow get past it.
Big of you.
Come on up, Richard. We're gonna go to,
Okay.
4K, an update by our Public Works Director on the 88 project in Pine Grove and the proposed maintenance project on Shenandoah Road. Morning. Good afternoon.
Good afternoon.
Yeah.
Just flipped past noon. I wanted to, couple items, suggested that we have an update board on some proposed work. First one, I guess we'll address is, there's been interest in doing improvements on Shenandoah Road. That's one of our more well-traveled roads. A lot of people use it. I think we all understand the importance of that corridor to the county's economy and that sort of thing. So there's, a level of interest there. And so we took a look at the road in general. We went through and did kind of a rating of the road within itself. So it doesn't pertain to any outside rating or whatever, so which parts of the road are in worse condition as compared to itself. And so we went ahead and did that, and then came up with a kind of a generic estimate of a cost per mile to, if we ground, say, 2 inches of asphalt off and replace with 3 inches. Be something similar to what we did, for example, on Willow Creek Road, where we ground down some of the existing pavement and come up with a smoother surface to apply the new layer of asphalt. Those costs are around $420,000 a mile. That seems like a large number, but which it is, and sometimes it's surprising to know how much it costs to do road rehabilitation. Of that cost, about 70% of that is asphalt. So, it's certainly an asphalt-driven estimate. So, in your packet, I put together a memorandum that kind of talks about this. There's a chart there that kind of shows the different sections of the road that we looked at, and the length and the relative conditions, and what an estimated cost to redo those sections of roads. If we did the whole road, which is, close to, it's close to 9 miles, you're looking at $3.8 million, which is, large amount. As staff, we would recommend, as you see the different ratings there, we would, and I got a subtotal there for the condition ratings of 1, 2, and 5.5, and that would be a recommendation of what we feel would be a good use of funds to do those sections, which is about 3.75 miles of road, starting from just past the intersection improvements with Fiddletown Road to travel, northward or eastward, up towards River Pines, approximately 3 3/4 miles, which would put us just past the lower Steiner Road intersection. Kind of give you in context what we're talking about. So that estimate is $1.575 million. We've got currently about 500,000 set aside in current SB1 allocations. We've put some aside on an annual basis for doing some micro surfacing, which I think is probably not beefy enough application for this road right now. We had about 40,000 in dig out set aside. So there's a total there is about 535 or so. We also requested $200,000 from the ACTC. There was some available money through Coronavirus Response and Relief Supplemental Appropriations Act that was sitting there, and we put in a request for it because looking for something from each county. So those amounts total $735,000. So that gets you about halfway through that estimated cost. Looking at that, we've got future SB1 funds to apply. There's also some other funds that are available that we could tap into. This went before the Public Works Committee for their review and consideration, what have you. What they felt would be good to do, we could bid the whole project together as a total 3.75 miles, or there's a kind of a natural cutoff point at 3 miles, and then do as a base bid and do the last 3/4 miles as a bid alternate, so that depending on how your numbers come in, if they come in favorable, you could award the contract based on base bid plus the bid alternate.
You said the whole project, do you mean the whole 8 miles? I don't think that's what we said.
Oh, the 3.7.
No, the 3.75.
Yeah, just when you said the whole project, we talked about 8 miles, I want to clarify.
Yeah, in my mind, that's what I'm focused is the project being at 3 3/4 miles. And if the numbers aren't favorable, then you just do the base bid, and then work towards the other sections in the future. One of the constraints out there, I spoke with the Vintners Association last year. I said, this is something that's we're looking to do. What are the constraints do you have timing-wise? Or what things do you have going on that this would really put a cramp in what you guys do out here? And the input I got back was there are several events that happen in the spring that are corridor wide with the vintners, and then in the fall, obviously with their harvest, which starts in September, sometime in September. So the input I got back from them was summer months, June, July, August, are really the times that would be least imposing on them. Not that there's a great time for anybody when you tear up the road. So, with that in mind, there's never a great time, but that would be the least intrusive time for those people out there, which we can work with, but that does limit when you can do the project. So that's kind of where we're at there. I know we'd like to get this work done sooner than later, and there's certainly an interest to try to get this work done this year. But sitting here and talking to you today about this, and there's still work left to do to pull the project together, I don't feel that we would have a good chance of pulling this off and getting the work done by September. If we were able to go into the end of the construction season into November, then I would say, yes, we could do that. But as we stand here today, towards the end of March, and it seems like a long time away, it takes, by the time we submit documents to GSA, where we go through when we do our bidding, to the time that a contractor actually starts work, there's about a 4-month or a 16-week time period that elapses between the different reviews. We got bid advertising, we have to do the bid analysis, and once we award a bid, then we collect insurance work money. It just takes a while to get someone going. So it is what it is, regardless of a project. That's just the time that it takes to get a project moving. So, you know, if we sitting here today, if I was able to hand GSA a bid package, you know, we'd be looking in mid-July. That wouldn't leave enough time to have this work done. So rather than try to push it and run the risk of change orders because we didn't, you know, dot all the I's and cross the T's in the analysis of the project, I'd like to be able to, you know, make sure we do a thorough job and get our package together, do any analysis out there. I'd like to do some soil borings just so we have a good idea of what we're running into. I don't foresee problems, but sometimes you don't see them until you do a little poking around. And that would give us time to do that. We could get our plans and specs together, a nice complete package, and bid this thing out early next year.
I think you should also check your culverts and maybe wouldn't be, I know, I think there's one out there probably failing pretty close to Fiddletown Shenandoah Road intersection.
Yeah, that's something we would do as well. And either we get those things replaced beforehand, or if that's not feasible, crank it into the project as well. Just make sure that.
Yeah, I think maybe some local contractors might do it cheaper than big boys.
So that's kind of.
So are you gonna have to put this out for bid next season, or?
That's what I'm suggesting. Yeah.
Okay.
We've been lucky this last season that we bid late, and fortunately there were a couple of contractors available, so we got favorable pricing. That doesn't mean it's going to happen twice, but it might be to our advantage anyway, because that road is still going to be getting torn up from the demolition trucks utilizing it, and any logging trucks too, correct?
Yeah, it was interesting. About at the end of January, I was out there because I wanted to see what was going on with the hauling, and I spent an hour just sitting there looking at vehicles. And at that time, in an hour's time, there were 25 10-wheelers hauling debris in an hour's time, going through down that corridor from River Pines to Plymouth. I went out there yesterday because I was saying, well, what's going on? And so I didn't see any debris hauling, but the amount of logging trucks has increased. I only saw one when I did back in January. Yesterday, I saw 15 trucks in an hour.
They are rolling in and out of there.
Yeah.
So I'm not sure how long that's going to last. And, you know, rather than
probably quite a while.
I would guess. So, you know, rather than try to push that envelope, because as much as we don't like that traffic on our roads, it is a public road, and, you know, it's until we close the road down, you know.
But I don't want to spend the money to improve the road to have them just tear it up.
Exactly. So I think it'd be prudent for us, that's the other reason, it'd be prudent for us to step back and make sure we get that stuff gets past us, we move forward and get a nice thorough job in preparation and have a good project ready for next year.
What is the Rule 20 proceeds? That's not from the money we got from the undergrounding, is it? From selling our credits?
Yeah,
it is.
yes.
Okay, so how much, we got a lot more than $339,000, right?
Yes.
We do, yeah.
Oh, but that's all I see allocated to this project.
Well, that might be all was needed at that point in time.
Yeah, that was,
There's more that could be.
yeah.
Yeah, there's money being set aside for equipment, possibly that one building up there to either build a new one or revamp the existing crew quarters.
So really that amount is kind of the balance. I mean, we have the ability, if we want to use more of that and less of the SB1 funds, I don't know if it makes, I don't know if there's a strategy if it makes a difference one way or the other. But, you know, we have some flexibility there.
Personally, I'd like to use more of it on the roads and less of it on buildings. I think that's the expectation of the taxpayers.
Well, we've been talking to the road crew about maybe not building a new building, but maybe revamping what's there, new lockers, better heater, and then putting some of that towards equipment, because we got a real equipment problem too.
Equipment is one thing, but we've been talking about that building forever. I think the road's more important than the building.
Oh, I agree 100%. That's one reason why we're talking to the road crew.
Yeah.
See if we can come to some type of amicable resolution on that.
And they have kind of lowered their sights on that building too.
Well, they said they'd rather have, at least ones I've talked to, they'd rather have equipment than a brand new building, but they would like their existing crew quarters. They'd like better lockers, stuff like that, because the lockers they have are small, and they seem pretty reasonable.
All right. I'm just looking for more money to put into your district's roads, so.
Well, I appreciate that. You know, one thing I would like to clarify, if you could, Mr. Vila, there's been this, nasty, kind of long life rumor that we took money from fixing Main Street of Drytown, Spanish Street, for this project. Is that true or not?
Well, as you can see, it's outlined in the memo, what's being proposed are funds that were previously allocated for Shenandoah Road, and then looking for future allocations through SB1 and maybe the Rule 20 proceeds, what have you. There haven't been funds diverted from any other allocation proposed to fund this project.
So we'd had a conversation. So there was funding programmed for work on Main Street, Drytown. Is that funding still there?
Yes.
Yeah, that's been out there. It's kind of irritating because they keep bringing it up. And I said, no, it's not the case. And that work hasn't been done yet. I think it's supposed to have been done probably last year, but the funds are still there.
Yes, the funds are still there.
Well, my preference would be to maximize the amount that we get on the roads for improvement at the time that we do the reconstruction, so. How the rest of the board feels.
So I guess, you know, I'm not sure, like I say, was here just for discussion and possible direction. If that seems like a path you want us to move forward with the scope of the project that I've laid out, then we can move forward and do more concentrated efforts in pulling together with that size of scope in focus.
The Public Works Committee can work in that direction and try to maximize the amount of work that can be done on that road. It's a very important corridor in the county, and I think we need to dedicate as much as we can to it.
That's why I put an option in there, Richard, because dollars are limited, but we thought if we get a good bid price and we can do more at the price we're looking at, we'd like to.
Does it make any sense to do the whole thing but over a period of time, or do paving contractors like a big chunk all at once? And is it more cost effective if, well, certainly it's probably to their advantage to do it all at the same time, right?
Well, yeah, I think anytime you put a project out, there are sunk costs for a project. The mobilization, you hear about the infamous mobilization charges, and you know, if you bid it in 3 different projects, you're gonna get 3 mobilization costs, or you'd only have one with a bigger project. The other factor is, you know, who knows what prices will happen, you know, what they do. If they go up, they go down. Well, they normally don't go down, but you know, asphalt prices, depending on when you bid the project, you know, it may be cheaper in the early spring of 2023 versus, say, June of this year, just on the timing. If you can get your project bid out earlier, you get on someone's schedule, there's a little more competition because the contractor's schedule haven't filled up yet. If you wait later in the year, you run that risk of, well, I guess I could fit this in, I'll throw a bid out, I'll throw this number at it. If I get it, great. If not, oh well, you know, I'm gonna get through the year, fine. So they're a little bit hungrier at the beginning of the season. Like Supervisor Forster mentioned, you know, we were fortunate on a couple of jobs where we got a decent number, but you can't always count on that. It all depends on, you know, the market and, you know, what your contractors are doing, what they got lined up for that year.
Well, the other problem I see too is I don't see paving all Shenandoah Road, Frank. I mean, I don't know about, you know, your districts, other supervisors, but I've got other roads in my district that need a lot of help too. So it's kind of triage, I guess.
All right. I just thought that, you know, you focus on certain key roads and then over the course of several years, fix them.
Well, there's still,
applying that model, but we probably just don't have the funds.
If we had a lot of money, I'd agree with you entirely, but we still got, Fiddletown Road's kind of a train wreck. Shake Ridge isn't that good neither. And you got, I mean, down in Richards, I think Buena Vista's got problems.
That's actually patched now.
Okay, well, yeah.
I'm not giving you my highway money like I used to, so.
Everybody calls me, but it's Pat's district, so. Oh, you did get a call from somebody.
I did.
Okay. Well, if there are any more questions on that, I'm gonna go to public comment on this part of the topic. If there's any public comment, nobody on Zoom, so. Ms. Lebenko?
Hi, thank you, Jamie Lebenko, District 5. First, I wanted to thank the board for acknowledging the importance of that corridor to our economy and to the wine industry. It is incredibly important as we compete with other wine regions like Lodi that our visitors don't have to realign their cars after the front ends of their cars after visiting our wineries.
No, that's from driving off the road when they drink too much wine, so, come on.
Well, I will tell you that those of us that are local know where the potholes and where the culverts are failing and all of those, and so you often find your locals swerving around them, which is creating its own level of danger out there. And I was going to ask a question about the haul trucks that are coming through. It's nice to know that members of the county have actually been out and witnessed that as well, because a couple times we've had contact where we've been told that Cal OES has said they've redirected them and they were never redirected. And I'm just curious if any funding might come to us from the wear and tear that they've actually put on these roads in that process that could potentially offset some of these expenses. Because it's a massive amount of impact. And it's 6 days a week, 10 hours a day, they're running out there. So I think it would be important for us to continue to revisit that if we can. Maybe we've hit a wall there. I don't know, but I do think that they've certainly made a huge impact on the roads out there. Earlier today, you had a discussion about various things that kind of made me think about the road condition. I have an elderly family member that lives in River Pines, and she receives Common Ground deliveries, and she told me that her Common Ground driver doesn't want to come to River Pines anymore because of the damage it's doing to his car driving up Shenandoah Road, which was just kind of shocking to me to hear that. And then on one last note, if you're going to be looking at culverts, I think one of the other major problems out there, not on Shenandoah Road specifically, but a stone's throw, is at the bottom of Steiner Road, and I'm sure Brian is familiar with this. I don't know if it is a collapsed culvert or something, but you almost have to wonder if you're going to be that close by, if that particular culvert could be repaired as well.
Talking to that guy.
Perfect. And I am curious about the OES, if there's any funding that might be able to offset the hauling that's been happening there.
I think we've attempted to talk to OES, Cal OES, and the problem is it is a public road.
Okay.
And that takes their efforts to restrict traffic flow and they're down. So I think they can try to get their truckers off. At least the demolition trucks aren't going en masse there now, but now the logging trucks are, so.
Right. And then regarding the timing of this, the Vintners Association mentioned that summer was the best, and I think it's probably important to note that the majority of our traffic out there for the wine industry is obviously Friday, Saturdays, and Sundays, but the importance of not having delays on those roads during harvest is really important to the quality of our product. When we harvest fruit, we try to get the fruit to the cellar cool. So if it gets stalled in construction and it's 95 degrees outside, that actually impacts the quality of the wine. So thank you so much for acknowledging that as well. Thank you.
All right, thank you.
Yeah, I can probably answer some of Jamie's questions. Richard talked about doing night construction. I think they do a lot of harvesting at night, so that probably wouldn't work. And as far as the OES deal, yeah, it's been kind of a runaround. Talked to Caltrans at first, and they said talk to this lady, and I talked to that lady, and it got to Mr. Funny and Samuel Swafford, and he said basically for us sending damage claim forms, which we're going to do. Probably going to wait to get most of our hauling done before we do it. It's kind of interesting talking to him. It sounds like it's a FEMA project, so that might be an avenue, because I know McClintock has talked about basically there's something we need some help with, and I think if they could get some funding, not to make our roads better than they were, but just to put them back to where they were before they started, would really be nice, because there's been a lot of traffic on that road. And they said they're going to go different routes, and then you see another 100 trucks a day coming through the valley, so on Shenandoah Road, so they're not using alternative routes.
Okay, any other public comment on this side of the discussion? Then we'll go, Richard, on to your next SR 88 Pine Grove project update.
It's right in front of me. Okay, here we go. This project, the board well knows, this has been an ongoing project for a number of years. It's been in the mix. It's finally gotten to the point where we can start to see the light at the end of the tunnel. Just in general, as a recap, you know, for people who may not know, the county has been a sponsor for a local road improvement project that's not being funded. It's being funded through local road improvement funds given out by the state. So it's not Amador County dollars necessarily funding this. It's outside state money for this. We're doing some basically improvements in the in the Highway 88 corridor in Pine Grove, doing some lane widening through that area. And this is basically from Ridge Road up to just past the elementary school. One of the biggest improvements there in that corridor is redoing that intersection at Highway 88 and Pine Grove Volcano Road. That will become a signalized intersection. And that's what, kind of in conjunction with that, we're going to be redoing the egress from the elementary school. And so that the egress would come out onto the Pine Grove Volcano Road instead of coming out onto the highway as it does now. And then that traffic will be controlled through that signalized intersection. So I should make it a lot safer for everyone involved as far as being able to get out of the school, you know, whether it's a pickup or drop off of kids or what have you, you know, of the traffic there. Including an upgraded pedestrian crossing that's there right now at the town hall, which is just east of Irishtown Road. There's going to be some sidewalks put in along the highway on each side. And there's going to be some provisions for some dedicated parking areas, kind of bump out parking areas along there. So, you know, as far as the project, the status of it, the engineering is pretty much done on that. As our right-of-way and easement acquisition has been completed, you've seen various items come before you when there's been needs for settlements for acquisition and such. So that's been coming through here in the last 2-3 years. The thing that's outstanding right now is a couple items with utility coordination. One is with regards to AWA, and they need to kind of buy off on there's adjustments to their system that are going along with this road, whether you got to adjust valves or vaults or what have you. So they need to buy off on those improvements because that would be wrapped into the project improvement itself. But probably the more pressing need is working with PG&E. There's about 12 poles that are in need of relocation. And the coordination of that's currently underway, although in all honesty, this is something that probably should have been going on for the last 2 or 3 years, and they're playing catch up right now. And which is frustrating. I know PG&E's had a lot on their plate over the last several years with different issues and such, but again, this type of stuff is not new. This happens all the time everywhere when they have road projects, whether it's this county or any county that's within their jurisdiction. So for some reason, this kind of got on the shelf for them, and so now they're scrambling to try to get this pushed through. We're trying to get a authorization from Caltrans to push forward with construction, authorization to come through in May. But some of that's going to hinge on whether we have all our utility coordination completed by then. So there's a little bit of a scramble going on right now. But that's really the only thing that's really left in order to move forward. And once, hopefully what we're looking for is authorization to move forward with construction to be received this year. And we could hopefully have potential construction next year for this project. So that's sort of where we're sitting. And we would also, in conjunction with construction, we would want to employ services of a consultant to do the construction administration and management and inspection, because this will be in essence, a Caltrans job at a local level. So all the paperwork and requirements and whatever that Caltrans would want on their jobs would be required here. So that's something we'd certainly want to hand off to a consultant. That would just burden in-house staff to no end when this project would be underway.
All right. Any board comments, questions?
No, so it's just the moving the power poles that
Well, you think that would be easy, but them coming out and assessing what needed to be done hadn't happened yet.
I see. So when they move these power poles, is it just for the construction, or is it going to be their final place during and after construction?
Yeah, this would be for a permanent relocation.
And these are the power poles close to the where the town hall is?
I couldn't tell you exactly, but they're up and down the corridor. I can't.
Okay.
I couldn't give you specific locations offhand. I know several of them were in that intersection with the Pine Grove volcano.
Pine Grove volcano.
Yeah.
Yeah. Okay.
I imagine probably at this point, undergrounding is probably way out of the question and the time frame they're looking at, and even dollars.
Probably, well, timing is one thing, but probably dollars is probably the biggest issue. We could underground it, but who'd want to fund that?
If PG&E wanted to do it, now would be the time.
True.
We could underground it, but we sold all of our credits.
Well, quite frankly, I don't think those credits could be applicable to this.
Not on a state highway. Plus, it would only cover about 300 feet, so.
Yeah.
All right. Yeah.
The abandoned home at Irishtown and 88, is this part of the project too?
It's,
You mean like a parking lot, or?
Yeah, well, Supervisor Axe was.
That was my understanding. It was going to be
demolished, but, there was problems with contacting the owner and then getting the, the release to do that, and that they were gonna have to, use eminent domain.
Well, that got cleared up. I mean, we needed to get some easement there.
Mhm.
And, it was difficult because the property was in trust. So there was a number of people involved, and a matter of getting them all together on the same page. But that's been worked through, and that's been taken care of.
Yeah, I think there was talk of putting a parking lot in there, but I think that went away.
Well, no, I think that there's still going to be a parking lot. It's gonna be a dirt gravel parking place. I don't think it's gonna be right where the house is. It's gonna be closer to the Irishtown Road.
Okay.
Or is the home gonna be demolished at some time, or is that our responsibility?
I don't believe that's part of our project. This is news to me, so it's not part of the project. You know, if the private property owners are gonna wanna do something, that's
We got an easement out there, but we did not get the property itself.
correct.
Okay, we all clear on that?
Clear as mud.
Okay. Any other comments?
No,
Any public comments? No? Richard, any more comments?
That's enough for one day, I'm sure.
Yeah, I think you got your direction on, Shenandoah Road and, this project, keep pushing on PG&E and, Water Agency. All right, thank you.
All right, thank you. Thank you, Richard.
Thanks, Richard.
Now we'll move back to item 4J, our presentation by the CAO and budget analyst regarding the state of the current budget and projections of the 22-23 budget as the budget process gets underway. You know, you broke the primary rule of PowerPoints. You got about 30 slides in here.
Yeah, I'll go through them very quickly.
Okay.
So, first and foremost, Karen has retired and Kim has taken over. So there's a new sheriff, a new budget sheriff in town.
Yeah.
So so she's doing a great job, and this is her first go around here, so, go gently.
Yes, please.
But she's done a great job so far. Just a quick reminder on what we approved for the 21-22 general fund budget. We had a total financing sources of $49.2 million. The, revenues, and where we are so far as of the end of December, we've received revenue-wise 48.47% of our revenues. So you can see where that stands in years past. It's higher than some, less than others. Expenditure-wise, we're right about 47%, also in the range of where we should be. All of our other funds so far, those all vary for where we are. This is right now a very strange time in terms of budgets. There's a lot of money coming in from a lot of different sources and a lot of different things that we are doing that we've never done before. So in terms of services, not budget-wise, but predicting where exactly the budget's going to be is a little bit more challenging now than it has been in the past. But certainly within our capabilities. So the actual and year-end estimate, we are projecting a reduction from $5 million carryover, which we had at the end of the year 21-22, to down to about $2.2 million. It should, a normal time, it'd be even lower than that $2.2 million. But it's tough to budget quite as accurately with things as variable as they are. So, but what have we seen in fiscal year 21-22? Our COVID-19 pandemic has been Of course, first and foremost, we've received 48% of our anticipated revenues, which is about normal. But one thing that it seems to be high with revenues is our sales taxes. So our sales tax receipts are estimated about 9% over where we thought we would be. Last year we saw this bump in sales tax. We talked about it. We didn't anticipate that it would continue on, but it has. Hasn't continued to grow like it did last year, but it still is beyond where we thought it was going to be.
Say, Chuck, real quick, is Bradley Burns all of our sales tax that we realize?
It's the sales tax that comes to us. Yes.
That comes to us, is the Bradley Burns?
Yes.
Okay. Right.
There are others. Prop 172 is also a half-cent sales tax, but that's calculated differently than the Bradley Burns. And that has not gone up quite as much as the Bradley Burns is, because it is pooled in terms of the state versus the Bradley Burns, which is a direct from the state for what we actually have spent.
Yeah, the Bradley Burns is local sales tax.
The local sales tax.
172 is state, portion of the state.
And then we get a portion of that back, correct. So TOT has also increased to the point of 12% of higher than we thought it was going to be. So that's also good. And transfer taxes are also coming in significantly higher, keeping the recorder's office hopping. And so we're about 110,000 over budget.
Would that be mainly like house sales, land sales?
I believe so, yes, and land and house, because that's a percentage of the recording.
172 is still sales tax, so why do you guess that's not consistent with the other increases shown?
So Bradley Burns is, if someone buys something here, then whatever the actual sales tax they spend is sent to our pot, so that it comes to the county. Prop 172 is they look at the sales tax for the state, the total amount for the state, not a direct amount spent here, but an amount for the state, and then they just apportion it to us. So it's not an actual amount. So they are calculated two different ways, which means that the county's sales tax is higher than the state sales tax. The whole, which is probably Prop 172.
So the 172 is probably a portion by population? Or?
I believe it's by population, yes.
So yeah, and then Measure M is just something additional tacked on.
Correct.
Local. Okay.
So these are our property taxes, just historically. If you remember, we talked about it in 09-10, that dip at the very beginning was because of a scheme that the state did in terms of a property tax swap, but we all are trending upward, continue to trend upward. Although I did see a report that housing sales are slowing. And that's a Bradley Burns 1% right there. You can see that it's popped up significantly for 2021. And this is the trend by quarter. This is what we use to predict going forward. It obviously does not trend quarter by quarter up, but as a whole, it continues to trend upwards.
Well, yeah, if you put a line through it,
yeah, you put a line through it, it'll
have a positive slope.
So expenditures in 21-22, we're seeing about $300,000 in general fund savings due to vacancies and unpaid leaves. We did prepay our PERS. That saved us another $124,000 that prepaid. So when we prepay at the beginning of the year versus over the course of the year, we saved that. It's now 6.8% over the course of the year, and we are projecting to spend $350,000 of that $1.2 million contingency. We've talked in the past about the GASB 87 issue and the HHS building and having that hit our general fund. We are still working on a solution, but we have put aside money to cover the expense for 21, 22. We have not addressed it in what we're going to see for 22, 23 yet. I'm still hopeful that we will have a solution for that problem, but right now we don't.
Is what's put in contingency, is that just rolled over from year to year?
Correct. That is what the unspent contingency along with unspent allocated general funds is all.
So it's kind of like a reserve?
It is a minor reserve, yes. It is, per the Budget Act, we aren't allowed to touch our reserves except in times of emergency or during the budget process. But we can touch the contingencies without needing to declare the emergency. So,
and we're gonna replenish it?
And we replenish it every year.
Okay.
Yeah. So at the end of the year, we take the unspent general fund and the unspent contingency. It all goes into the carry forward. So when you see the carry forward, that includes the unspent contingency.
Oh, so it's not as flush as we think it is.
What do you mean?
Carry forward.
The carry forward, well, yeah, it's good. It's so when I say that general fund, our carryover should be about we're about $2 million. Then yeah, we're budgeting pretty well. So the Coronavirus Relief Act, we've received a lot of money to cover staff costs for our health operations, for our a lot of sheriff's operations. Public health just received notice of another $2.2 million appropriation, and we've got the ARPA funds that we still have to spend to a certain degree. Although we've got several years to complete that. The tree mortality projects continue on. This is just a summary of everything that we've done. Cumulatively, all this work has cost the county $143,000, which is quite the bargain, as it were. Because there's a lot of work, a lot of trees we got removed, and not that much cost for a considerable fire reduction risk. So projecting for the 22-23 budget, we are projecting a fund balance this year to be at $4 million.
Okay, is it 4 million? Because I thought I read
that's what I was.
2 million.
I think, yeah, that's fair.
Sorry, pushing the thing back on.
Right. Yeah, I think I was thinking it was around 2 too. So
okay, all right.
We are projecting property taxes to increase by 3.5%, which is about what it was last year. That's a increase in general fund revenue of $660,000. The property taxes in lieu of ELF is estimated to go up by 4%, which is another $208,000. And then the 1% we are showing to increase by 5%. We will continue to keep an eye on all of these, of course, as everything develops. Our base budget, we do not show any excess tax loss reserve transfers. We talked about that policy or 2 board meetings ago, and the base budget revenue has been reduced by $4.49 million for due to losses in not losses, but we won't have CARES Act funds in there or significant tree mortality funds coming in from the state.
But we won't need the CARES Act funds.
Correct.
Normally.
Yeah, it wouldn't reason it was just a spike, as it were. So not really a loss.
So on Jackson Rancheria reducing contribution by 25%.
Yeah.
Is there a reason for that, or is it?
I took that out. We're not seeing the calls, just
Oh,
because.
you took it out?
Yeah,
Oh, okay.
the sheriff is working with the Rancheria to come up with a different way to.
Oh, okay.
So I
They're still offsetting their impacts.
yes,
Okay.
yeah, they're not, they are, but, we're looking for, to come up with a more predictable way of doing that rather than having it.
Could that have also been because of the pandemic and there was less traffic there, or?
That's why.
Okay.
Right.
Did you plug that 2.2 million in additional money that went to public health? That was on a previous page that we covered that.
That's not in that would be in the public health fund. It wouldn't be in the general fund.
So it's dedicated to, in its own account there.
The public health, yeah, that'll be tracked separately. And then expenditure-wise, we have given out some wage increases. We're estimating a $383,000 increase there. Our PERS unfunded liability for the general fund only, the costs are estimated about $294. Our health insurance costs are going to go about $177. That's 5%. For all plans, our contingency we would set at 1.2 million again, which is about 2.6%. And A87 will go down. That's just a function of that overhead study we do every year, and that will go down by 92,000. Meaning that those costs are picked up by departments outside of the general fund, and we're holding other operating expenditures as status quo from 21-22. I don't believe that's necessarily going to hold true. Once we get the requests back from the departments, there are going to be costs that are going up because everybody's seeing costs are going up. We talked about the vet costs and animal control. That's a good example. There's not much we're going to be able to do about certain things. Gas is going to be expensive for the county. And then increases to liability and workers' comp are going to hit the general fund at 429. We'll talk about that in just a minute because that's not looking good either. Here it is.
For you, Chuck.
Yes, sir.
That CalPERS is showing $294,000 of unfunded liability.
That's just to the general fund. So to the rest of the county, it's significantly more. So if you take all of realignment and
okay,
yeah, that
so when
the
you
numbers weren't matching up. So okay, that's fine.
Sorry, when you refer to liability, like in this, and then the next slide, the graph, is that the unfunded liability?
No, this is
legal liability. Okay,
our legal liability.
That's what I thought.
Yeah. So you can see what our liability and workers' comp costs have done historically, but they are going to be hitting us to the tune of about $2 million. Now that is countywide. That's not just the general fund, but yeah, it's we've had a spike, several year spike. Other economic factors right now, obviously, it's a tumultuous time, but I talked about that. There are certain things we know we don't know, and that's always the challenge. The jail expansion project, probably the big the elephant in the room. It's coming at us, and it's getting more expensive by the day. And the state is not cooperating with us as we try to get this thing bid and out to the street, so we can get it underway. If they don't treat us a little bit better, then there's no way we're going to be able to afford what may come down in terms of a bid. But we will keep working and trying. The health realignment, I don't think we're going to see an effect down there, particularly with that additional $2.2 million. But health realignment down the road, when things return to normal, there's going to be a challenge over there. And the COVID-19 impacts, continued impacts on the state and local economy, the inflation we're seeing, the costs going up all over, all across the board, always a challenge. So,
I've asked our general services director to start keeping track of what the state is costing us for re-preparing documents for them. So we're gonna send them a bill, and then we're gonna present that to our legislators and anyone else that needs to know what places like state general services and the state fire marshal are costing counties out there, because we're not the only ones complaining about it.
yeah, it's absurd and costing some significant, money, and really putting the whole project in jeopardy. So these are our CalPERS costs. You can see what we're seeing in terms of the normal costs. So you remember the normal cost has been separated out, separate from the unfunded liability costs. So this is the cost percentage-wise of 1 year of service. So we pay for this for each employee for each year of service, just for the normal cost. That doesn't include the unfunded liability. And then the unfunded liability comes in later, and you can see what it's costing us. Each plan costs us in total. We're paying total for unfunded liability, and that's unfunded liability alone, not including the normal costs, $7.5 million. So, but that is across all funds. That's not just the general fund. Right now, Kim's magic ball says there's a $40,000 surplus. So that includes everything, all the cost increases that we're aware of, all the costs, everything that we know is going up contractually. You know, rent for various buildings, cost increases for staff, everything. We throw it all in there along with all our revenue increases, and we're sitting there. Now, we haven't received the individual requests from the individual department heads yet. So if they ask for additional staff or if they ask for additional costs, those will all come out of that.
So did you put a guesstimate for those departments in this?
They've all been modified upward to what we know.
So you just 2%, 3% or something?
We increased it, you know, line by line, employee by employee for the raises that we know have been agreed to already. And so this is it's a very accurate prediction, but then you get into the other requests that are for various reasons. And we'll work on those. It will continue to evolve. Usually at this point in time, we're actually working on a little bit of a deficit. So we're in better shape than normal.
The likelihood of our surplus increasing is probably not too low.
We'll see.
For historical
as I usually do.
Where are we usually right now?
Usually we're running a little bit of a deficit.
Like,
so I will.
About 100,000 or something like that.
Yeah, probably maybe even a little bit more. So as I usually do, I sit here, rule over it with an iron fist. So until we get to you, and then you as a board can grant or deny whatever it is you would like to do. But the GSA cost allocation, IT communication matrix hadn't been updated, things like that. But we have included everything that's going to go up that we know is going to go up. So we are still 6 months away from the end of the fiscal year, 3 months away from the end of the fiscal year now. The carryover is probably the thing that will vary the most between now and the end. Our next steps, budgets are going to be sent to the department heads. They're actually, most of them have gone out. So the department heads have those. Like I said, the salary increases have been incorporated. Our general reserve is $7.7 million. We have that payroll reserve that we talked about when we shifted from the monthly pay period to a biweekly weekly pay period. That created a $1.1 million surplus that will come due at some point in time, in the future. And then we've got the loans to the jail expansion project, $3.41 million. So, we will continue to refine this, and we'll talk about it further in May when we do our budget workshop. And speaking of that, we are projecting that budget workshop to be on May 3rd. And this is the time where I ask you to pull out your calendars and tell me whether or not that works. And or if you want to put it to a different day.
That works for me. We've got a Board of Equalization meeting, but that could probably be shoved around.
I usually trample over the BOA for this.
That's good.
Rooney might be listening.
I hope he is. So we could announce the May 3rd, because that's an all-day meeting.
Let's move, calendar it.
Okay. All right, so I will put that down. In what we've done in years past is to do public works separately, and I think that worked well, so that we can go through the public works, the SB1 expenditures, as well as any capital maintenance projects otherwise they wanted to talk about, and that helps that budget workshop go faster. And I will do the same thing if the board's okay with that.
Yeah.
And that's the remainder of the budget calendar. The departments have the budgets now. We've done the budget orientation for new employees and new management employees at least. And April 1st, the budgets are due back to CAM, and I will meet with the department heads around the 6th, 8th, and we'll do our budget workshop. As you recall, the recommended budget approval is required by the end of June. So we usually aim for the first meeting in June, just in case there's a hiccup. And so June 14th is when we'd like to get it approved. If it goes to the 28th, that is okay.
Just a curious question, Chuck. We don't really, as far as that jail really tied that thing, we can't not do it.
It would be tough, but if our budget comes in $10 million over
we can't do it.
10 million, there's no way we can find that. I mean, I don't know what we would do. We're going to have to find some alternatives, but right now they're predicting it to come in about $5.5 million over our budget, just because of the length of time that the various delays have caused us. Because time is just, when the construction costs are escalating like they have been, time is money.
When you say delays, it wasn't county delays, it was a CEQA lawsuit by a neighbor.
The CEQA lawsuit, and then that delay, the state has pushed us back to, begin review of the whole project all over again. Even though they reviewed it and approved it before, now they pushed us back to review and approve it again. And now they're finding all these problems that they had now that they didn't have when they approved it the first time. It's just,
they're making up problems, and I think we can get past that. So I think turning back is not an option. We've already heard that the ADA lawsuits will be eating up millions of dollars if we don't have a fix in place.
So, we just need to get this thing out on the street and bid.
Okay. Are there any other board comments on?
Can we take a loan on also? Can we?
We could identify a way to do that, yes.
So finance the jail project if we have.
But you gotta remember, the more we finance, once we get this thing open, we're gonna be spending lots of money on additional staff as well. And, we needed this thing to be built, with funds from the state. It just would have been the easiest thing to do, but we have to borrow.
Okay. Any public comment? Discussion here? No Zoomers? Yes. Good afternoon.
Afternoon. My name is Ty Polskamp. I'm a resident of Jackson, and I'm representing myself. And I'm just a curious guy. Do we know how much we spent on gas last year?
We do, but I'll have to find it for you.
Yeah, I would be curious, because I know how much I spent, and I expect to spend a great deal more.
Yeah, so I can find it. I'm sure I can send it to you.
Yeah, we'll probably be doubling our budget for fuel. Okay, any other questions? If not, then we're gonna move on to item 4L. And I'm not gonna read the whole thing. This is a reconsideration of an item that the board approved previously in error, and rescind the prior adoption of the resolution and permit staff to withdraw the matter from consideration.
So board, there's a memo in the packet. I won't go over all of it, but this is sort of turning out to be more of a cleanup than anything else, because I've learned that the developer has since satisfied the map conditions. So I still think we should reconsider and then rescind, and then let it be let that final map go through the correct way, just so everything's done correctly. But it really doesn't matter that much anymore, because they have complied with the conditions since the last meeting.
But we still need to take the action.
I would still recommend doing the reconsideration, voting on the reconsideration, and then rescinding that prior resolution. And then the board, and then basically staff won't ask you to act on that previous item, but they will bring back one in the future now that it's been complied with.
I'll make a motion.
Board voted unanimously to approve it before, so any member can make the motion to reconsider.
So moved.
I'll make a motion to reconsider the resolution. So,
You want to second it?
Sure.
Moved by Supervisor Axe, second by Supervisor Onetto to reconsider the prior approval. Any discussion, further comments? All those in favor?
Aye.
All opposed, motion carries. Supervisor Onetto, I'll let you make this motion.
You can make the next one.
Sure, I'd make a motion to rescind the prior adopted of the resolution and permit staff to withdraw the matter from consideration to remaining conditions are complete.
Second.
Moved and second to rescind the prior adoption and the rest of what was said. So with that, any further discussion? All those in favor?
Aye.
Aye. All opposed? Motion carries. Go to the approval of the minutes. I had a couple minor changes, and I think on the consent agenda portion, those should have been slashed out because we pulled 2 items from the consent agenda. So,
Okay.
Frank, you had a couple changes?
Yeah, I gave them to Jennifer. There's one thing. That's all. But maybe she should check with Supervisor Neto, but I think that's what he meant.
Okay.
Yeah, a couple changes too.
Okay. I'll make a motion to approve with those changes. The minutes.
Hold on 1 second. I want to make sure it's okay. One was on something as quoted wasn't quite correct, and the other one was on page 7 on a motion. It talked about that the project will have significant environment and that mitigate negative declaration included in the staff report. Should probably have we'll have a but who have a significant significant effect on the environment. Just because more words missing, we can just add those in. Is that okay with, on page 7, Greg, the last paragraph? After significant, there's some wording missing, I think. And I don't know if that was just cut and pasted, that was something wrong earlier.
Well, why don't you, instead of looking at it now, why don't you meet with Supervisor Onetto after and
That'll work.
Solve that on the language?
Yes.
Is that acceptable?
Yep.
Okay. Been moved and seconded to approve it wasn't seconded. I need a second.
Second.
Moved and seconded to approve the minutes with changes, and That item will be, discussed and resolved. With that, all those in favor of the motion?
Aye.
Aye.
Aye. All opposed? Motion carries. We'll go to our addendum now. Last item up, Board of Supervisors discussion and possible action, the chairman's signature on a letter of support for HR 690 as it relates to the immediate suppression of wildfires.
Actually Supervisor Brown and I asked to have this put on the agenda. We had some outreach from McClintock on some of the staff on this.
McClintock and Lamalfa, right?
In Lamalfa, yep. And basically what it is, it's, you know, the Forest Service has had some kind of, erroneous policies of letting stuff burn and not going after wildfires as hard as they could and should, especially in bad fire season, or, you know, weather. And what this does really is saying, hey, go out there and suppress those fires. And I had some concerns because I talked to, some of McClintock staff. I said, I don't want to go out there and stop all, you know, really put a hit on prescribed burning because we need that to clean up the forest. And they're like, we're looking at the language, and there's some language that does allow prescribed burns, because I don't think we're clean up the forest without prescribed burns in the right time of the year. Not when they had the one up there in Tamarack, the Tamarack fire. You don't want to have prescribed burns in those conditions, but like 2 months ago would have been a beautiful time to been burning a lot of the forest, and they should have. But so this would basically jumpstart the Forest Service, get out there and get fires put out before they get big.
To go along with that, the Caples fire was one of the ones where the prescribed burn had gotten out of control, and so that's the situation that, you know, they should have pulled the trigger a little bit sooner to get that fire back under control. And that's what this part of this HR is trying to talk about.
And something else that's pretty good in there, it talks about items A3 and A4. They can only initiate a backfire or burnout during a wildfire or the responsible incident commander, and shall control any such initiated backfire or burnout until extinguishes. And if you look further, under 4B, any person aggrieved by a violation of those two preceding paragraphs 3 and 4 may bring a civil action against the United States in the appropriate federal district court for actual damages. So if they're doing having some malfeasance going on and burning up homes and towns and businesses, I think it gives people recourse in the courts to recoup their damages from the federal government. So
overall, it's probably a good bill to support. I don't know in this Congress if it'll pass. It seems like Randy Moore, the U.S. Forest Service chief, has already given direction to, and I was looking for the language, I can't find it right now, but he's already given direction to put fires out rather than let them burn. So I don't think it's harmful to support it, and that's kind of been our position. If there's a fire burning, put it out before it rages, because the wind comes up.
Or if they're going to have prescribed burns in the right time of the year, that's wonderful. But when you got a fire at the end of July, super dry, and you have what I hear staff in a helicopter that's flying around saying, hey, we better put this thing out, it's going to get away on us. And lo and behold, that went on for days.
So Randy Moore has already given direction to put the fires out. So this would just be on top of that, but it's got the additional language on the liability too.
That'd be very helpful.
Any further board discussion? Any public comment? And can I hear a motion?
I'll make a motion to approve the signature of the board chair on a letter in support of HR 690 as it relates to immediate suppression of wildfires.
How about we change that to HR 6903? I think there's a typo in there.
Okay, 693. I was just
6903.
reading. Yeah, you're right. 6903. Yeah, 690, and then there was a 3. Yeah. So Thanks.
And moved by Supervisor Axe, second by Supervisor Crew to support this, legislation. Any further discussion? All those in favor?
Aye.
Aye.
All opposed? Motion carries. And we are at the conclusion of our meeting, and, see you again in a couple weeks, so we are adjourned.